Yeah, very good evening all of you. Is everything okay? Clear? Audible? Okay. So, I think all of you have attempted the examination, AIIMS CRE mock test for mock test 1. Okay. And so, we'll start with Pharmaceutics, right? So, we'll start with Pharmaceutics. The first question from Pharmaceutics is, what is the disintegration time for entry coated tablets in acidic pH? Okay, repeat the question. So, I think you can see the question in the display. Is the question visible in the display? Yeah. So, what is the disintegration time for entry coated tablets in acidic pH is our first question. And our options are A 15 minutes, B 30 minutes, C 6. Them, most of us may go wrong because of time constraint and everything. Okay, so many things happen during the examination. So in acidic pH is our question, and the right answer is, what's the right answer? The right answer is 120 minutes. Okay, so 120 minutes. So once we will go through the disintegration times for various tablets. Next slide, please. Yeah, fine, thank you. Okay, and so regarding different tablets, we will see the disintegration times of various tablets. So the first one is uncoated tablets. So the tablets which do not have any coating, or which we usually call them as normal tablets. Okay, uncoated tablets. So uncoated tablets, the disintegration time limit according to IP or as per the monograph is 15 minutes. Is usually 15 minutes. 15 to 30 minutes we can say generally, 15 to 30 minutes. 15 minutes is the disintegration time for conventional tablets. And coming next, moving forward to the film coated tablets. In film coated tablets means usually the tablets which are coated using the film coating polymers. Okay, film polymers like HPMCs, PEG, PVP, etc. So all these things, they are used as film coated polymers. So is there any issue? Yeah, okay, no problem. So for film coated tablets, the disintegration time is usually 30 minutes. 30 minutes for film coated tablets, 15 minutes for conventional tablets. Can I have some ink in this? Okay, 15 minutes for the conventional tablets and sugar coated tablets. So for sugar coated tablets, so we usually think it's a common assumption, may not be yourselves, but most of the people, they usually think about sugar coated tablets. What we usually think is, no, they have a lesser disintegration time compared to film coated tablets. Okay, so we will have certain assumption. Okay, because sugar is highly hydrophilic and it is highly water soluble, so sugar coated tablets should have a lesser disintegration time, but it has a higher disintegration time than that of the film coated tablets. Because why? What is the reason? What may be the reason? Because sugar coated tablets, they undergo a series of reactions, they undergo a series of coating. Okay, so in this there are fillers, there are seal coating, subcoating. Okay, so there are so many steps which make the bulk of the coat. Okay, in sugar coated tablets especially, the coat is bulky compared to that of film coated tablets. Okay, so because of that reason, because the coat is so very bulky, so for the disintegration of that coat, it takes more time. Okay, that disintegration takes more time. So for that reason, sugar coated tablets have a more disintegration time compared to that of the film coated tablets. And coming to dispersible tablets, yeah, we all know it is usually within seconds, less than 3 minutes. Less than 3 minutes, mostly the disintegration time is in seconds for dispersible and effervescent tablets also. And coming to the Question, the enteric-coated tablets. Okay, so as the name indicates, the enteric-coated tablets, as the name indicates, what they are coated with the enteric coating polymers, enteric polymers. So what are the examples of enteric polymers? What are the examples for enteric polymers? Yes, any answers? Can I see any answers? Yes, can I see any answers, please? Yeah. Okay. Why no answers? Okay, no issues. So in the enteric coated polymers, the examples of enteric coating polymers are phthalates. Okay, phthalates, especially cellulose acetate phthalate, I need that, please. Okay, especially cellulose acetate phthalate, CAP polymers, they are all known as, they are known as CAP polymers. Okay, cellulose acetate phthalate. All the phthalate polymers and also polyvinyl acetate phthalate. Okay, so in this way there are so many enteric coated polymers. The polymers, enteric coated polymers, which are usually used in the enteric coating. So enteric coating, the word itself means the drug has to be released in the enteron, that is nothing but the intestine. So they are designed in such a way that the tablets are not dissolved in the stomach, and these tablets, they stay in the stomach for, so the approximate GRT, okay, the gastric residence time, the approximate GRT of the tablets is usually 2 hours. So till 2 hours, as long as they are in the stomach region, they are not disintegrated. So the approximate time is 120 minutes for the disintegration of enteric coated tablets in the acidic pH. That's what, in the stomach. Okay, so once they enter into the intestine, from this they move into the intestine, that is nothing but it has a basic pH which has a, basic pH. So in intestine, the approximate time for the disintegration is around 60 minutes. Okay, within 60 minutes the tablets will get disintegrated. So this is about our first question. Hope that was clear. Okay, so yeah, moving forward to the next question. Question number 2. Which of the following is not a method of tablet manufacturing? Okay, I repeat the question. Question number 2. Which of the following is not a method of tablet manufacturing? And we have our options as A, wet granulation, B, dry granulation, C, direct compression, and D, emulsification. Okay, so these are the options. So what is the right answer from this question? Not a method of tablet manufacturing. Please remember the question. Follow the question. Do we have any chat messages? Okay, no issues. So whoever are available or online, they can answer. Yeah. So and the answer for this question is emulsification. Option D, emulsification. Okay, emulsification is not one of the methods of tablet manufacturing. So next slide, please. Yeah. So once we go through, as we all know, there are so many methods of tablet manufacturing. Okay, there are 3 methods for the tablet manufacturing process. So the tablet manufacturing process is inclusive of 3 methods. So what are the 3 methods of tablet manufacturing? Dry granulation, wet granulation, and direct compression. Dry granulation, wet granulation, and direct compression. Okay, so these 3 are the various methods of tablet manufacturing. So what about dry granulation? We will see each of them in slide details. We will see slight details for each of them. Dry granulation. So what is dry granulation? What is the method of dry granulation? So, okay, dry granulation, sometimes it is alternatively, it includes or it is alternatively known as slugging. It is alternatively known as slugging, where the granulation, okay, where large lumps, large size granules or large size slugs or roller compacts, they are formed by without using a binder, without using a liquid binder. Okay, without the use of a proper liquid binder, if the granulation happens, that is known as dry granulation. That's why we are mentioning the word dry. Okay, it does not use a proper liquid binder. Okay, next coming to the wet granulation. Wet granulation, it includes the use of a liquid binding agent. Okay, it involves the use of, do we have any issues? Yeah, it involves the use of a liquid binding agent here. Okay, so most of the times what may be the binding agents? What may be the binding agents? Yes? We have certain hydrophilic binders like the starch paste. Okay, and certain organic binders like the PVP. Okay, organic binders like the polyvinyl pyrrolidine, etc. These all can act as binders. Okay, that is wet granulation. And what is next is direct compression. What is direct compression? So the tablets, all the ingredients, all the tablet excipients are mixed together in a proper manner so that the tablets are directly compressed. All the excipients are compressed to directly evolve the tablets. Okay, so this is about direct compression. So in this, the odd man out in the previous question was emulsification. Emulsification method is usually used in the preparation of what? Emulsification is a method that is used normally in the preparation of what? Okay, so we are not using it for tablets, that is okay. So for what the other dosage forms we use this emulsification method? This method of emulsification, where are we using again? What are the alternatives? Yes, emulsification method, we use these methods in the preparation of semi-solid dosage forms, especially ointments. Semi-solid dosage forms, especially ointments. So for the preparation of ointments, gels, lotions, okay, for the preparation of lotions, all these type of dosage forms we use this. So there are different methods, fusion method, emulsification, there are different methods. In that, emulsification is one of the methods which is used in the preparation of semi-solid dosage forms. Okay, so this was about the second question, question number 2, and moving forward to the next question. So hope everyone of you have answered it right. Okay, and the next question is question number 3. We have the third question, question number 3. So it is about, and the question is about the capsules. In capsule filling, what is the purpose of the glidants? Okay, in capsule filling, what is the purpose of glidants? So our options here are A, increase the weight of powder, B, reduce friction between the particles, C, improve flow properties of powder and enhance the dissolution rate. Okay, so what's the right answer? Okay, yes, and the right answer is improve the flow properties of powder. Okay, so wherever it is glidant, the word itself glidant, the word glidant itself indicates something which is gliding. Okay, so it is gliding means something which is related to the flow. Okay, so glidants wherever they are used, whether it may be in capsule, whether it may be in a tablet, whether it may be in a powder, or whatever may be the type of dose. Yeah, okay. Sorry for the interruption. There was a power cut. So, getting back, we were discussing about the third question, question number 3. In capsule filling, what is the purpose of glidant? So, just now, and in wherever we have stopped, we have discussed that glidant is something about gliding. Gliding is nothing but which is related to the powder flow. Okay, whatever it may be, it is related to the flow. Okay, so in these options, we can see, yes. So it improves the flow properties of the powder. Okay, glidants, what they do, they improve the flow properties of the powder. Okay, so what are the ingredients or what are the excipients that increase the weight? What are the excipients which are used to increase the bulk? We can't exactly call it the increasing the weight, but we have to mention it as increasing the bulk. So what are the ingredients that increase the bulk of the powder or the mixture? Diluents. Okay, diluents or fillers. Diluents, also known as the fillers. These are the excipients that are used to increase the bulk of the preparation. And the excipients that are reduce friction between the particles, option B. What are the ingredients? Excipients that are used to reduce the friction between the particles. Yes, friction between the particles. Anti-frictional agents. Anti-frictional agents between the particles. Here we are talking about between the particles, the substances which reduce the friction between the particles, nothing but. Okay, and next, enhance the dissolution rate. The substances that enhance dissolution rate, what are they? So usually solubilizers. Okay, solubilizers are the substances that can enhance the dissolution rate. All these, they contribute to enhance the dissolution rate of the tablets only or capsules only. Okay, something like a breaking agent, disintegrants. Okay, all these they support the dissolution rate of the particles, capsules or the dosage forms. Next. Okay, so moving forward to the next question, which of the following is used as a base in ointments for water soluble drugs? Used as a base in ointments for water soluble drugs. Okay, options are A, wool fat, B, polyethylene glycol, C, lanolin, and D, petrolatum. And the right answer for this question is polyethylene glycol. Option B, polyethylene glycol will be the right answer for this question, because all the substances mentioned here are used as bases in ointments. Okay, till that part of the question, which of the following used as base in ointments, till that part of the question, yes, all are true. All are true, right? Wool fat, PEG, lanolin, petrolatum, everything is right. For water soluble drugs, okay, we have a clause here. What is the clause? That is nothing but for water soluble drugs. So all the remaining, so we have various types of ointment bases. Can I have the next slide, please? We have various types of ointment bases like hydrocarbon bases, that is nothing but oleaginous or hydrocarbon bases, absorption bases, emulsifying bases, and water soluble bases. Okay, so hydrocarbon bases are oleaginous bases. They are especially useful for petrolatum. All these substances, they come under hydrocarbon bases, and we have certain absorption bases like anhydrous lanolin. Okay, absorption bases like anhydrous lanolin. Okay, and also hydrophilic petrolatum. So these are known as absorption bases, and emulsifying bases like polyethylene glycols. Okay, emulsifying bases like hydrophilic ointment, vanishing creams, and polyethylene glycols, they come under emulsifying bases, and water soluble bases are polyethylene glycols. Okay, here they are especially used for water soluble or hydrophilic drugs. Okay, next question, please. Okay, and the next question is, what is the main advantage of direct compression in tablet manufacturing? That was a very simple question. What is the main, and sometimes we get confused. Okay, these questions, these type of questions are usually given in the competitive examinations so as to confuse the aspirants. So what we usually think, no, do we really get these type of very simple, so simple questions in the examination? Yes, sometimes it happens. Okay, even in the final examination, sometimes it happens. That is just to confuse whether whether you are taking it in a positive sense or you are digging deep into it. Okay, for this type of questions, we don't need to dig deep. Okay, there is no sense of logic is required. Okay, just go with the question, go with the flow, right? So it is suitable for moisture sensitive drugs, requires no granulation, improves drug stability, and all of the above. Yes, right? So direct compression, definitely it is suitable for moisture sensitive drugs, because just now we have discussed about dry granulation, wet granulation, and direct compression. So we were discussing that. So what are the methods suitable for moisture sensitive drugs? Manufacturing methods. So both dry granulation and direct compression, both of them can be used, because we have discussed that in dry granulation there is no requirement or there is no use of a liquid binder. Okay, we are not using any liquid binder. So dry granulation, direct compression, both are suitable for moisture sensitive drugs. Okay, and there is no step of granulation in direct compression. Yes, right. So we discussed that all the excipients are mixed together and they are directly subjected to compression to generate tablets. And also it improves the drug stability. So direct compression, definitely it improves drug stability, because there is no use of any liquid here. Okay, here we are not going to use any liquid, or we are not subjecting it to any other pressure as in case of dry granulation. Okay, usually what happens in dry granulation, we subject the mixture to certain pressure in terms of slugging or roller compaction. So here we are not doing any of these things. So it definitely improves the drug stability. So all of the above is the right answer for this question. Moving forward to the next question. Question number 6. Which of the following is a non-ionic surfactant used in emulsions? Okay, very important question. Very important question, all competitive examinations point of view. Okay. So the important and the confusing ones. Usually especially in case of emulsions and all, these are the most confusing ones. Okay, whether it is ionic, anionic, cationic, non-ionic. Okay, so these are slightly confusing. So, and the question here is non-ionic surfactant used in emulsions, that is sodium lauryl sulfate, cetrimide, polysorbate 80 and benzalkonium chloride, and the right answer is polysorbate 80. So what is polysorbate 80? Anyone? Can I have any answers? Anyone in the live chat? What is the other name for polysorbate 80? Can anyone of you answer? Other name for polysorbate 80 is nothing but tween 80. Okay, it is nothing but tween 80. Okay, so polysorbates are nothing but polyoxyethylene sorbitol esters. Polysorbates are nothing but it is a short form of polyoxyethylene sorbitol esters. Okay, so all of them are known as tweens, and we all okay, here we don't have any polyoxyethylene group, they are sorbitol monoesters. Okay, so they are known as sorbates. Sorbates are nothing but spans. That is the major difference between tweens and spans. In tween there is a polyoxyethylene group, and whereas that is not present in the spans. That is the major difference. And we have a series. Of these polysorbates like from 20, 40, 60 and 80. 20, 40, 60 and 80. So what is polysorbate 80 or tween 80? Tween 80. So they are esters of fatty acids. Polyoxyethylene sorbitol esters of various fatty acids. So the fatty acids involved here are, for 20 it is, so it is nothing but LPSO. It is nothing but LPSO. L is nothing but laurate, P palmitate, S for stearate, and O is olate. And O is oleate. The same is applicable for spans also. Both for tweens and spans, the same grading, 20, 40, 60, 80, the grading is one and the same, except for their chemical name. Okay. So, and what about sodium lauryl sulfate? Within the options, what about sodium lauryl sulfate is a sodium lauryl sulfate. Wherever you see this term sulfate in a surfactant, or in some groups, wherever you see the word something which is related to sulfur or sulfate, it is exclusively anionic. We need to remember this. We need to remember this. This is a benchmark. Okay, sulfate, sodium lauryl sulfates or sulfetrimide. C for cationic surfactant. Cetrimide is a cationic surfactant, and also the benzalkonium chloride. Benzalkonium chloride, even it is a cationic surfactant. It is a quaternary ammonium compound. It is a quaternary ammonium compound, benzalkonium chloride. Okay. Yes, please. Next slide. Yeah, we have various surfactants here. Examples. With examples, anionic, cationic, non-ionic and amphoteric surfactants also. Okay, amphoteric surfactants, there is one more name. Okay, there is one more name for amphoteric surfactants. They are known as zwitter-ionic surfactants, because amphoteric nature means it exhibits a zwitter-ionic nature. So zwitter-ionic surfactants, they are also known as. Okay, so moving forward to the next question. This was about surfactants. And question number 7. The process of converting powder into granules by adding a binder solution is called. Repeat the question. The process of converting powder into granules by adding a binder solution is known as milling, sieving, granulation and blending. Okay, so here we have like milling and sieving, we can exclude them. Okay, we can eliminate those options at the beginning itself, milling and sieving. We can eliminate them at the beginning itself. So, but granulation and binding, if we are not really clear, okay, if we have a slight confusion in our minds regarding this, okay, so by addition, by adding a binder, okay, when we are using the term adding a binder, so sometimes because we are adding, we can think that it can be blending also, but we are converting the powder into granules, so the right answer will be granulation. Okay, next. So this is the procedure of granulation, the spraying of the liquid, wetting of the liquid by using a binding agent, and then development or establishment of a solid bridge by means of solidification. Then we go for drying. Yes, please. Yeah. Question number next. Moving forward to question number 8. Which of the following is a sustained release dosage form? Okay, very interesting and important question. Which of the following mentioned here is a sustained release dosage form is the question. Okay, and we have options as A, chewable tablets, B, effervescent tablets, C, matrix tablets, and D, sublingual tablets. Okay, so these are the various options, and the right answer here is matrix tablets. Only matrix tablets here mentioned are of sustained release type. Okay, and effervescent tablets, here the remaining options, effervescent tablets. No, effervescent tablets, they cannot be sustained release. Okay, because they have a very faster disintegration time, we have discussed. Okay, because of the presence of effervescent mixture. Because of the presence of effervescent mixture, effervescent tablets, they have a very shorter disintegration time, and also their dissolution is also within 30 minutes. It has to happen within 30 minutes only most of the times. Okay, and also sublingual. What are the examples for effervescent tablets? Yes, what are the examples for effervescent tablets? Say yes, effervescent tablets, Disprin. Okay, we have certain tablets like Disprin, etc. And also chewable tablets. Examples for chewable tablets? Yes? Yes? Any answers for chewable tablets? Chewable tablets, antacids. Okay, so we have certain antacids. Okay, and sublingual tablets. Examples for sublingual tablets? Yes, the most widely used sublingual tablet, glyceryl trinitrate. Okay, GTN, glyceryl nitroglycerine tablets. Okay, nitroglycerine, isosorbide dinitrate, all these are used as sublingual tablets, and we have several matrix tablets or SR tablets. Okay, next question please. Okay, what is the primary function of disintegrant in a tablet? Okay, in tablets usually, what is the function of a disintegrant? So we have various tablet excipients, like various excipients in tablets like diluents, disintegrants, binders, glidants, okay, lubricants, many things like that. Okay. Okay, there are many excipients. So in that, what is the function of disintegrant especially? So the options here we have are A, they bind the particles together, B. They reduce friction. C. Promote breakup of tablet in GI tract, or they improve the taste. Improve the taste. So what is the right answer for this question? Primary function of disintegrant? Yes. And it promotes the breakup of tablet in a GI tract. What do disintegrants do? They break down the tablets in the GI tract, within the GI. Break down the tablets doesn't mean that they break down the tablets while they are in transit or during formulation or nothing like that. Okay, disintegrant, they usually, its function is to break up. Okay, its function is to break up, disintegrate. Its function is nothing but breaking up. So, why it does not break up in the external environment? Why it breaks up the tablet only in the GI tract or only in such type of medium? Okay, so it can also break up in the external environment also, right? Okay, but disintegrants, all the disintegrants, they are mostly highly hydrophilic substances. They perform that action of disintegration occurs only when it comes into contact with an aqueous medium. Okay, only this happens when it comes in contact with an aqueous medium. Okay, and so what are the particles that bind? What are the substances that bind the particles together? Option A, binders. Option B, that reduce the friction. Anti-frictional agents like glidants, lubricants, etc. And the substances that improve the taste. Is sweetening agents or flavoring agents. Okay, all these are the substances that improve the taste of the tablet. Next question, please. Okay, question number 10. Which of the following is used as a preservative in multi-dose ophthalmic preparations? Very, very important question. This is a very, very important question, this one. Okay, preservative in multi-dose ophthalmic preparations. Okay, so this kind of questions, what they usually do, what we usually go through the situation is, what usually happens is, we generally get stuck by seeing the terms like multi-dose. Okay, they are what we can say, they are tactic words, misleading or tactic words that are used in the questions. So you should not be misled. Okay, and our options are A. Glycerin, B. Phenyl mercuric nitrate, and C. Sodium chloride, D. Boric acid. And the right answer here is preservatives used in ophthalmic preparations, phenyl mercuric nitrate, PMN. Okay, so whether it may be a multi-dose preparation, whether it may be a single-dose preparation, most of the times phenyl mercuric nitrate is generally used as a preservative in ophthalmic preparations. Okay, whatever it might be. No, and what are the remaining options here? Glycerin. So what is the function of glycerin in an ophthalmic preparation? What do glycerin? Yes, glycerin, what does it do? It is a viscosity enhancing agent in ophthalmic preparations. We usually go for most of the ophthalmic preparations except eye drops, most of them solutions, suspensions, or so such type of solutions, whatever, such type of formulations, whatever we are using in ophthalmic preparations, to retain, further retention within the eye cavity, within the ophthalmic cavity, further retention, we use certain viscosity enhancing. They need to be little viscous. Okay, so for enhancing that kind of viscosity, we use glycerin. It is a viscosity enhancing agent. And sodium chloride, it is a isotonicity adjuster. Sodium chloride as an isotonicity adjustment agent. And boric acid, what is the function of boric acid in an ophthalmic preparation? Boric acid or sodium borate we use in ophthalmic preparations. What is their function? Yes, it acts as a buffer. It acts as a buffering agent. Okay, so this is about question number 10. Moving forward to question number 11. The term levigation is associated with the preparation of, yes, very beautiful question actually. The term levigation is associated with the preparation of what? Of tablets, ointments, syrups, capsules. Okay, so what is it associated with levigation? It is associated with the preparation of ointments, right? Okay, So what is levitation actually? What is levitation? So the previous slide please. What is levitation? The previous slide please. Levitation is something, levitation means what we usually think is, levitation is nothing but it is a type of mixing. No, that is not true. Levitation, whenever we see the picture of levitation or when we hear that word, we think that it is something related to mixing. No, levitation is something related to size reduction. Levitation is the term which is related to size reduction. Okay. So there are different terms that are related to size reduction especially, and the main conflict occurs between pulverization and levitation. Here we have two terms, that is pulverization. Size reduction has two synonyms, kind of synonyms. Okay, they are synonymous. Pulverization and levitation. Okay, so pulverization, what is pulverization? It is also related to size reduction, and levitation is also related to size reduction, but pulverization is reduction of size of the particles. Okay, any solid particles, reduction of size of the solid particles by using any substances like a mill, okay, by other methods. Okay, in levitation also you are reducing the size of a particle, but with the help of a liquid. Okay, here also we are, so levitation for liquid. Liquids are used for levitation. Okay, in pulverization there is no liquid. Here you are taking the help of a liquid to reduce the particle size and mix. Okay, reduction and mixing. Okay, so that is about levitation. So here in tablets we don't need any levitation. Tablets, syrups and capsules, we don't need any levitation. If we need, yeah, if we have need an optimum particle size, we can go for pulverization or milling. Okay, and in ointments we need levitation. Okay, fine, move to the next slide please. Thank you. Yeah, next question number 12. Which of the following is not a component of simple syrup? Which of the following is not a component of simple syrup? And our options here are A. Sucrose, B. Water, C. Alcohol, D. None of the above. Okay, which will not be a component of a simple syrup? Yes, and it is alcohol. The right answer is C. Alcohol. Alcohol. Simple syrup does not need any alcohol. Okay, it is a solution. It is a solution related liquid preparation, but it is devoid of alcohol. Simple syrup, it consists of only two ingredients, that is nothing but water and sucrose. Simple syrup consists of only two ingredients, that is nothing but sucrose and water. Okay, so what is the composition of simple syrup? Yes, this is also a very important question. This usually appears. Usually one of the most prominent and frequently appearing questions in most of the competitive examinations. What is the composition of a simple syrup? Any one of you? If anyone can answer? Yes? Most of you know this, right? Okay, simple syrup. The composition of simple syrup is nothing but it is 66.7%. 66.7% weight by weight sucrose. Okay, weight by weight of sucrose in water. Simple syrup is nothing but 66.7% weight by weight sucrose in water. According to IP, according to the Indian Pharmacopoeia, it is nothing but 66.7% weight by weight sucrose in water. Okay, so if it is, sometimes they also give it in volume terms. Okay, sometimes this question will be asked in volume terms. If it is in a volume term, it is nothing but 85% weight by volume. It is not now here it is not weight by weight. Here it is weight by volume. Weight by volume sucrose in water again. So this is according to the USP. According to USP, the simple syrup is given in. According to USP, the simple syrup is given in weight by volume percentage, and according to IP, it is given in weight by weight percentage. Okay. Yeah, moving forward to the next question. This was about simple syrup. And moving forward to the next question. What is the HLB range for water in oil emulsifying agents? What is the HLB range for water in oil emulsifying agents? This is also very, very important question. This question will occur in each and every competitive examination, not exactly the same, but something related to the HLB range. Some question related to the HLB range will occur or will appear in almost all the competitive examinations. Okay, and our options here are A1 to 3, B3 to 6, C8 to 16 and D13 to 18. So what is the right answer for water in oil emulsifying agents? It is nothing but 3 to 6. Okay, the right answer is 3 to 6. Okay, so just we will go through the HLB ranges of various emulsifying agents. Next slide, please. Yeah. So seeing when we go through the HLB ranges of various emulsifying agents, it is nothing but the HLB value starts at 1. HLB scale. Okay, this HLB scale is also known as Griffin scale. Okay, it was given by the scientist by name Griffin. HLB scale was given by a scientist by name Griffin. So it is also known as Griffin scale for emulsifying agents or surfactants. Okay, so the HLB range for various agents are, it starts from 1 and ranges till 16 to 18. So 1 to 3 is anti-foaming agents, 3 to 6. If the HLB range is 3 to 6, it is nothing but emulsifying agents, water and oil emulsifying agents. 7 to 9 is wetting agent, 8 to 18 is emulsifying agent, that is oil water emulsifying agents. 15 to 20 is solubilizers and 13 to 16 is something around 13 to 16 it falls as detergents. Okay, it is nothing but detergents. So we have to remember this HLB is nothing but hydrophile lipophile balance. HLB is nothing but the hydrophile lipophile balance and the value. Okay, and according to the range and as the value, as the HLB value increases, goes down means it goes down in the chart 1 to 20. As the value increases, what happens? Usually the hydrophilicity of the agents increases. Okay, the hydrophilicity of that particular surfactant will increase. The higher the HLB range, higher the hydrophilicity of the surfactant. Please. Yeah. Which of the following is a lyophobic colloid? Next question, yeah, this is also an important question. Which of the following is a lyophobic colloid? And the options here are A gelatin, B starch, C gold sol and D agar. Lyophobic colloid among these. Yes, what is it? What is it? Anyone? Yes, and the right answer is gold sol. The gold solution. So what are lyophilic and lyophobic colloids? We will see in the next slide. Yes. Yeah. So what are lyophilic salts and lyophobic salts? So for a clear understanding, I have given an explanation here. So usually what happens? Lyophilic or which is something affiniated to. It has some affinity. Philic means loving. Okay, phobic is something hating. Right. So lyophilic salts. In lyophilic salts, what usually happens? The dispersed phase and the dispersion medium. So we all know that colloids are biphasic dosage forms. Okay, so we are discussing something about colloids here. Colloids are biphasic dosage forms. We all know that very well, which consists of two phases, that is nothing but a dispersed phase and a dispersion medium. A dispersed phase and a dispersion medium usually. So what usually happens? Lyophilic salts, what do they usually indicate? It is nothing but the dispersed phase and dispersion medium. They have a very good affinity to each other. Okay, they have got a very good affinity to each other. Okay, and we have certain functions here, certain properties like they are not charged. Okay, in this the colloidal particles in lyophilic salts or lyophilic colloids, what happens? The particles that are present in the colloidal medium, they may or may not be charged. Okay, but in lyophobic colloids, they are definitely charged. Okay, they are charged particles. So in lyophobic colloids or lyophobic salts. Okay, so there are certain differences, and the examples for lyophilic salts. So all of them, like a gelatin solution, whatever we have seen here, gelatin, starch. Okay, polymer solutions. Most of the polymer solutions, they form lyophilic salts, lyophilic solutions. And the metal complexes, metal solutions. Most of the times in lyophobic solutions, we see the metal salts like a gold salt, gold solution, silver solution. Okay, that means solution of sodium, like silver chloride or silver nitrate. Okay, gold chloride. That solutions, they are known as lyophobic solutions. Okay, so shall we move to the next question? Hope that was clear so far. Yes, we are moving to the next question. In capsule manufacturing, the size 0 capsule holds approximately how much powder? Okay, how much powder does a size 0 capsule hold? Okay, most of the times, usually what happens is, whenever we discuss about these capsules, okay, whenever we discuss about capsules and its sizes, so one question from capsule sizes is also very prominent in most of the competitive examinations. But usually what happens when we are discussing about capsule sizes, we discuss about the volume. Okay, most of the times what comes into picture is volume. This not capacity does not usually come into picture. Most of the times volume comes into picture, but capacity is not usually discussed. But in these examinations, yes, we can expect that. Okay, and our options are A 100 mg, B 300 mg, C 500 mg and D 700 mg. So what's the right answer for capsule 0? How much powder does it hold? It holds approximately 500 mg of powder. Okay, so the next slide please. Can I have the next slide? Yeah, we can see here the capsule sizes and their capacities and volume. See, size capacity, weight capacity and volume capacity, both we can go through once. So size 000, 000, okay, so the largest capsule is nothing but which is 000. The largest capsule is 000 and the capsule with the least size is 5. Okay, the capsule sizes range from 000 to 5. Usually the 000 is the largest capsule and capsule number 5 is the smallest size of capsule. Okay, and usually this 000 and 000, they are not used for human purposes. These size capsules are mostly used for veterinary uses. 000 and 00, they are mostly used for veterinary purposes, and from 0 usually they are used for human uses. Yeah, if you need any of these explanations, if you need them, you can just take a screenshot, or this will also be available. This session will also be available on our YouTube channel. Please do watch it whenever you need. Okay, and also the previous one, the previous slide, please. Yeah, so we were discussing about the average capacity of the capsules, right? So in the average capacity, you can see in the average capacity of 0 sized capsule, it is something around 400 to 800 mg. So in between we have 500 mg. So that is the average size, average capacity. And also volume capacities are also very important. We need to remember those volume capacities. Okay, next. Yeah, so this completes the questions from Pharmaceuticals. So far we have discussed questions from Pharmaceuticals, AIIMS CRE Pharmacist mock test question paper. In the discussion, we have completed the Pharmaceutics part and now moving to the Pharmacology part. So the question is, Pharmacology is very important in this especially in these particular examinations, as we have gone through the records, the previous analysis and previous records also. There were approximately more than 20 questions, approximately 20 to 22 questions from Pharmacology, especially in these AIIMS CRE examinations. So please concentrate more on Pharmacology. You will get simple questions but more number of questions. Okay, so which of the following drugs act by inhibiting the HMG-CoA reductase? Okay, which of the following drugs act by inhibiting the HMG-CoA reductase? What is HMG-CoA? What is HMG-CoA? Hydroxymethyl coenzyme A. Okay, HMG is nothing but hydroxymethyl coenzyme A, and our options here are gemfibrozil, atorvastatin, ezetimibe and cholestyramine. So what are all these drugs? Which class do they belong to? All these drugs, they belong to the class of Anti-hyperlipidemic agents. These are nothing but all these. The question is about anti-hyperlipidemic agents. So as soon as you see the question, so this is more important in competitive examinations. As soon as you see the question, first we have to identify which class or which section does this question belong to. So sometimes because during the competitive examinations, it is a common practice that we usually get stuck. Okay, so sometimes we are very familiar with the options, but we don't easily remember about the class. Okay, once you remember the classification of these drugs, so it will be very easy for you to resolve the question also. So in question resolving, this is the main factor we have to apply, especially in pharmacology. Very important. Okay, so the options, the previous also all the options here are about the anti-hyperlipidemic agents, and the right answer HMG CoA reductase inhibitor here is atorvastatin. All the statins, they belong to HMG CoA reductase inhibitors. Okay, so once we will go through a slight classification, quick classification of hypolipidemic or anti-hyperlipidemic drugs. Okay, what are they? HMG CoA reductase inhibitors like statins. Okay, and sterol absorption inhibitors like ezetimibe, and bile acid sequestrants, nothing but cholestyramine and cholestyramine, etc. And yeah, and also we have fibrates like clofibrate, fenofibrate, etc., zemfibrozil, all these So whenever we are seeing this term like fibrate, fibro, so it is related to fibrates. Okay, what are fibrates? What is the mechanism of action of fibrates? Fibrates are nothing but PPAR alpha activators. Fibrates are nothing but PPAR alpha activators. Okay, and also we have certain nicotinic acid derivatives like niacin, etc. So this is the short or quick classification of hypolipidemic drugs. Yes, moving forward to the next question. The most serious adverse effect of metformin is, very important question, the most common question. Okay, the most serious adverse effect of metformin is A, hypoglycemia, B, lactic acidosis, C, weight gain and hepatotoxicity. So what is the serious adverse effect of metformin among this? It is nothing but lactic acidosis. Yes, lactic acidosis is the one of the most common serious adverse effects of metformin. Okay, it does not have the adverse effects of hypoglycemia, weight gain, hepatotoxicity as with that of the other class of drugs. That is the reason, that is the major reason, because metformin is the first line drug in oral hypoglycemic agents even till date. Metformin is the first line drug of choice. It is the first line drug and it is the drug of choice because of this reason it has very less side effects compared to all the remaining. Metformin okay, so with least side effects. Okay, so once we can just go through the classification. So primarily for or classification of oral hypoglycemic agents, insulin is not a oral hypoglycemic agent, though it is used, it is an anti-diabetic. It is not a oral hypoglycemic. It is not taken orally most of the times, right? Insulin. Next, coming to the sulfonylureas like glibenclamide, glipizide, glyburide, etc. So many drugs, glimepiride. So the main side effect associated with, especially we are focusing on the adverse effects, right? So the major adverse effect will be hypoglycemia and weight gain. The most serious adverse effects by sulfonylureas are mostly contraindicated. Usually what happens is, because of this reason, sulfonylureas and all, they are used in combinations. They are not advised or they are not prescribed in a singular manner. They are mostly used in combinations. Okay, because of this particular reason, because of hypoglycemia, weight gain, etc. And also meglitinides we have, and also biguanides, metformin, which has gastric irritation, it has GI side effects and lactic acidosis. Okay, and also GLP agonists, DPP-4 inhibitors, thiazolidinediones. Yes, thiazolidinediones also have a cardiovascular risk. Okay, and other drugs like PPR agonists, alpha glucosidase inhibitors, and SGLT2 inhibitors. So this is a quick classification of oral hypoglycemic agents, and the most serious adverse effect of metformin is lactic acidosis. Yes, the next question please. Can I have the next question? Yes. The next question is, which drug is contraindicated in patients with a history of sulfa allergy? Okay, drug contraindicated in patients with a history of sulfa allergy. What does sulfa allergy exactly mean here? So, allergic to sulfur. Sulfa allergy, what exactly does it mean in this question? The sulfa allergy means allergic to sulfur. Yes, is it? No, allergic to sulfur drugs, especially sulfonamides. Sulfur drugs, especially the allergic to sulfonamides. Okay. So, which of these drugs is contraindicated in patients that have a sulfonamide allergy, sulfonamide drugs? So, which are not to be used in combination or together, with which have a drug interaction with sulfonamides. The question here is, which of the following drugs has a drug interaction with that of the sulfonamides? Okay, and the options here are, so first we need to sometimes what happens is seeing this type of questions, history of sulfa allergy. So we get blocked at some places. Okay, so what happened to the history of sulfur drugs contraindication? So we focus on these, that's what these are misleading terms. These are tactic terms, contraindicated history. So it is all about the drug interaction, that's it. We need to decode the question. Understand the question and first decode it, then you try to answer. Okay, you will have enough time. This all comes with the proper practice and proper revision. Okay. So our options here are A, furosemide, spironolactone, hydrochlorothiazide, and both A and C. What's the right answer? The drugs that are so all these are furosemide, spironolactone, hydrochlorothiazide, all these, they belong to the class of what? Which class do they belong to? They belong to the class of diuretics. Okay, all these are nothing but they belong to the class of diuretics. Okay, in this furosemide and hydrochlorothiazide, they are contraindicated, especially loop diuretics. Almost all the loop diuretics. Furosemide belongs to the class of loop diuretics, right? And hydrochlorothiazide belongs to the class of thiazide diuretics. Almost all the loop diuretics are contraindicated with sulfonamides. When they should not be used, they have an interaction with sulfonamides. Okay, because they has a cross sensitivity. Because of the reason of cross sensitivity, if they are used together with sulfonamide drugs, they induce hypersensitivity reactions. They induce allergic and hypersensitivity reactions. They have a cross sensitivity to the sulfonamide drugs. Okay. Yeah, moving forward to the next question. Which of the following antibiotics is associated with the red man syndrome? This question has appeared in the previous AIIMS CRE examination, which has happened around, I think, 3 to 4 months back. Yeah, around 4 to 5 months ago. Also, we had an AIIMS CRE examination, AIIMS CRE Pharmacist examination. This was a direct question which has appeared in that examination. Which of the following antibiotics associated with the red man syndrome? Okay, so the most common question, important question, and what is the drug that is associated? Vancomycin. Okay, the right answer is vancomycin. So, this red man syndrome, it is also known as vancomycin flush syndrome. Okay, the disease itself, it is known as vancomycin flush syndrome. Okay, and what is red man syndrome? The next slide, please. Yeah, what is red man syndrome actually? So, the people, they turn red. Red man means nothing but they turn red. Why? Why do they turn red? Okay, it is not, we have to remember sometimes there is a chance of questions appearing in this way also. We have to remember. So what we usually think when some person turns completely red after inducing or injecting a medication, and if someone turns completely red immediately, so what is it? What do we call it? We call it allergy, right? We call it allergy. But in case of vancomycin, it is a non-allergenic reaction. It is not an allergic reaction, red man syndrome. It is a non-allergic reaction. Okay, so it occurs usually because of the infusion, sudden infusion or fast infusion of vancomycin, intravenous infusion, faster intravenous infusion of vancomycin will cause this syndrome, and it is completely non-allergic. Okay, so it can be reduced by inducing a histamine. The immediate introduction of histamine, immediate introduction of an antihistamine will reduce this Redman syndrome. Okay, all the remaining and the previous options. The previous options like ceftriaxone, gentamicin and azithromycin, yes, they also cause allergic symptoms. Okay, they also cause certain side effects, but this Redman syndrome is nothing but a side effect. This is a non-allergenic side effect, and they induce the allergic side effects. Okay, next please. Yeah, which drug interaction occurs between warfarin and cotrimoxazole? Okay, the drug interaction that occurs between warfarin and cotrimoxazole. Reduced absorption of warfarin, increased metabolism of warfarin, increased anticoagulant effect and bleeding risk, and decreased effect of warfarin. So what is the right answer? What is the right answer? For warfarin and cotrimoxazole, what happens? It increased anticoagulant effect and bleeding risk. Why? Why does it reduce the anticoagulant effect and bleeding risk? Why there is a bleeding risk? Yes, what may be the reason? What exactly is the drug interaction here? Yes, cotrimoxazole. What is cotrimoxazole? First of all, this is also a very important question. Cotrimoxazole or cotrimoxazole. What is it? The composition of cotrimoxazole is nothing but sulfamethoxazole with trimethoprim. Sulfamethoxazole with trimethoprim is the combination that is nothing but it is named as cotrimoxazole. Okay, so it is contraindicated to be administered with warfarin. Okay, because this cotrimoxazole, what happens? It is an enzyme inhibitor. The reaction here is nothing but, no one will give you the direct question. The enzyme, is it an enzyme inhibitor or inducer? Okay, actually the question is about the enzyme inhibition here. Okay, it is an enzyme inhibitor. Cotrimoxazole, what is it? It is an enzyme inhibitor. So what happens? It inhibits the CYP enzymes. It inhibits the CYP metabolizing enzymes. Due to the inhibition of CYP metabolizing enzymes, what happens? This drug, the other drug is nothing but warfarin. Okay, warfarin is not metabolized. The metabolism of warfarin is stopped because the enzymes which metabolize warfarin are inhibited by this cotrimoxazole. Okay, because of that inhibition, what happens? This warfarin is not metabolized. As long as it is not metabolized, what happens? It remains in circulation. As long as it is not metabolized, it shows its pharmacological action and it remains in circulation. Because it remains in circulation for a longer time, what happens? It exhibits its anticoagulant activity continuously, which causes bleeding. Okay, because warfarin is an anticoagulant, we all know that. Okay, so because of increased effect. Yes, next question please. The antidote for benzodiazepine overdoses. Very, very important question again. The antidote for benzodiazepine overdose. A. Naloxone, B. Flumazenil, C. Atropine and D. Pralidoxime. What is the antidote? So this drugs and their antidotes is very, very important. You will get at least one question. Okay, most of the competitive examinations you will get at least one question from this drugs and their antidotes. Okay, so what is the drug? What is the substance that is used as an antidote for benzodiazepine overdose? Flumazenil. It is a benzodiazepine antagonist. Flumazenil is a benzodiazepine antagonist. And we will see about the remaining drugs also. Naloxone. Naloxone, it is a antidote for? Naloxone is an antidote for which kind of drugs? Opioids. Naloxone is an antidote for opioids. Yes, we can see certain drugs and their antidotes. Okay, for narcotics and opioids, naloxone will be a antidote. Okay, and the previous slide please. And atropine? Atropine for anticholinergics. Atropine is an antidote for anticholinergic drugs. And pralidoxime, this is a very important question. Pralidoxime is repeatedly asked. Pralidoxime is an antidote in organophosphate poisoning. Pralidoxime, it is an antidote for organophosphate poisoning. Okay, yeah, next slide. Yeah, we can see certain drugs and their antidotes. For paracetamol, it is acetylcysteine. So you can, any one of you need this. This is quick information. This is all these is for quick read and quick information. You can take a screenshot if needed. Okay. Next, moving forward to the next question. Which of the following drugs is contraindicated in myasthenia gravis? Which of the following drugs is contraindicated in myasthenia gravis? What is myasthenia gravis actually? What is myasthenia gravis? It is an autoimmune disorder, right? You all know this. This is also a very prominent question. Questions about on myasthenia gravis, anything. So which of the following, questions on myasthenia gravis, what usually occur is, which of the following drug is used in treatment of myasthenia gravis? Which of the following drug is used in the diagnosis? Okay, because there is a drug that is also used in the diagnosis of myasthenia gravis. Okay, in diagnosis, in treatment, okay, contraindication. So there are many questions associated with myasthenia gravis actually. So myasthenia gravis is a autoimmune disorder. It is a autoimmune disorder. So usually what happens due to because of this autoimmune disorder, so what usually happens is this acetylcholine is not taken up. The circulating acetylcholine is not taken up at the neuromuscular junction. Usually what at the neuromuscular junction, the acetylcholine has to be taken up in order to keep the muscle activity, in order to retain the muscle activity. So usually what happens, in order to impaired uptake of acetylcholine, there is a impaired muscle activity. So usually what the muscular weakness, okay, all these things are associated with myasthenia gravis. There is a lesser decreased muscle activity. Okay, so options here are A, neostigmine, B, prednisolone, C, gentamicin, and D, pedostigmine. Okay, so here the odd man out or contraindicated drug is, especially, and this is also contraindicated. Contraindicated in myasthenia gravis is all the aminoglycosides, almost all the so gentamicin belongs to the class of aminoglycosides. All the aminoglycosides are contraindicated in myasthenia gravis. Okay, we can follow a mnemonic here. For the drugs that are contraindicated in myasthenia gravis, we can follow a mnemonic A, B, C, D, E. Okay, we can follow a mnemonic like A, B, C, D, E. A is nothing but, so there are many drugs, I am mentioning only some aminoglycosides. A is nothing but aminoglycosides. B for beta blockers. B for beta blockers. C for chloroquine. C for chloroquine and ciprofloxacin. Yes. Also fluoroquinolones like ciprofloxacin. And D for D-tubocurarine. D for D-tubocurarine and E for magnesium. Okay, we are highlighting E in the magnesium. Okay, so this is also one of the mnemonics. Yeah, here also we can see, even in the screen also you can see a mnemonic exacerbate. Okay, exacerbate is something increase. Something is nothing but increase. So exacerbate P, which increase myasthenia gravis. We have so many drugs, erythromycin, macrolides, lignocaine, aminoglycosides, so many drugs. Yeah, you can make a note, you can write down, or you can take a screenshot of this. So the previous slide please. Yeah, so coming to the neostigmine. Neostigmine, what is there any relation between neostigmine and myasthenia gravis? Yes, definitely neostigmine is the drug that is used in the treatment of myasthenia gravis. Because neostigmine is a cholinesterase inhibitor. It is an anticholinesterase, right? Neostigmine is an anticholinesterase. It is a cholinesterase inhibitor. So what happens? It will prevent the breakdown of acetylcholine and it will make acetylcholine more available at the neuromuscular junction. So both neostigmine, pyridostigmine, both are the drugs of choice in myasthenia gravis. And prednisolone, it is also an immunosuppressant drug. It is also used in myasthenia gravis. And we discussed that there is a drug that is used in the diagnosis of myasthenia gravis, that is nothing but edrophonium. Very, very important. Hydrophonium, it is used in the diagnosis or detection of myasthenia gravis. Okay. So, yeah, this was about myasthenia gravis and the related questions. Moving to the next question, yeah. Which drug causes the gray baby syndrome in neonates? Which of the following drug causes the, yeah, even this question has appeared in the recent AIIMS CRE Pharmacist examination. Not only that, we have also gone through this question in recent 2-3 competitive examinations, other competitive examinations also. Okay, gray baby syndrome in neonates. A. Chloramphenicol, B. Amoxicillin, C. Erythromycin, and D. Cefotaxime. What is the right answer? Gray baby syndrome. Yes, the right answer is chloramphenicol. Okay, the most common one, the most commonly used common drug question. This is okay. Recently appeared in the question in the AIIMS CRE paper also. Okay, so we will see certain syndromes once. Okay, certain common syndromes. We will just go through gray baby syndrome by chloramphenicol and blue baby syndrome, nitrates. Okay, by nitrates in water, they will cause blue baby syndrome. Ray's syndrome, this is also very, very important. Ray's syndrome is one of the most prominent side effects of salicylates, especially aspirin. Okay, whenever we discuss about the adverse effects of aspirin, one of the common and most prominent adverse effects of aspirin is Ray's syndrome. Okay, and also red man syndrome, just now we have discussed about vancomycin. Purple toe syndrome. Okay, purple toe syndrome, warfarin. Next slide, please. Yeah, and also flu-like syndrome, Steven-Johnson syndrome by sulfonamides. Yes, so these are very, very phenytoin. Also, purple glove syndrome, phenytoin. Okay, so these are all the one of the oral contraceptives. They are associated with Cushing's syndrome. Okay. So Montelukast syndrome. So all these are very, very important drugs and their associated syndromes. These are very important on the competitive examination point of view. That's why I just brought them to your notice. You can just note down and just go with a quick revision. Okay. Yes. Yeah. Which of the following is a common side effect of ACE inhibitors? ACE inhibitors. So here again, coming to ACE inhibitors. ACE inhibitors, they belong to the class. What is their main classification? They belong to the class of antihypertensives. ACE inhibitors are nothing but they are antihypertensives. Angiotensin converting enzyme. ACE is nothing but angiotensin converting enzyme inhibitors. And our options here are A. dry cough, hyperkalemia, angioedema, and all the above. Yes, what's the right answer? Yes, go with a gunshot procedure whenever we are seeing something related to all the above. Okay, so go with all the above. No, not always. This technique does not always apply. Okay, it applies only sometimes. We need to just concentrate, we need just recall. Okay, don't give a call, just give a recall. Yeah. So these are the various classes of drugs along with their side effects. Various classes of antihypertensives especially and their specific side effects, and in this we have ACEs. Yes, for ACE inhibitors and ARBs we have especially this side effects of ACE inhibitors and ARBs. Angioedema will be one of the prominent side effects. Okay, next. Yeah, which drug should be avoided in gout due to hyperuricemic effect? Okay, the drug which has to be avoided in gout due to hyperuricemic effect. So we all know that gout is nothing but it occurs due to increased uric acid levels. Okay, increasing of uric acid. So this which of the drugs causes hyperuricemic effect? That will, so in that, for that reason it is avoided in gout. Losartan, hydrochlorothiazide, amlodipine and metoprolol. Again, the question is related to antihypertensives again. Okay, antihypertensives is a very vast topic. Yeah, it is very common for us to get 1 or 2 questions out of antihypertensive drugs. And the right answer is, right answer will be hydrochlorothiazide. Yes, thiazide diuretics, they are avoided in gout due to this hyperuricemia effect. All the remaining, they do not show any kind of effect. Okay, next question please. Yeah, very important question again. Which drug causes ototoxicity and nephrotoxicity? Okay, out of the given drugs, from the given drugs, which drug causes ototoxicity and nephrotoxicity is the question. And we have our options as A. ciprofloxacin, B. vancomycin, C. gentamicin, and D. clindamycin. So what's the right answer? What is the right answer? Your right answer is gentamicin. Okay, and the right answer is gentamicin, and gentamicin belongs, because gentamicin belongs to the class of aminoglycosides. Okay, here the question is about the adverse effects of antibiotics. Okay, adverse effects of various antibiotics. Okay, so all these we have here: ciprofloxacin, vancomycin, gentamicin, clindamycin. All these things they belong to the classes of antibiotics. Okay, gentamicin is an aminoglycoside and it's a blind rule. Okay, thumb rule: aminoglycosides. Amino. Okay, amino means N for nephro, O for auto. Okay, the name itself, amino. Yeah, N for nephro and neuro also, yeah. But mostly it is nephrotoxicity. So N for nephro, O for auto. Amino glycosides, they usually go with that thumb rule. N for nephro, O for ototoxicity. Okay, so we have another drugs also, ciprofloxacin, fluoroquinolones. So we have certain classes of antibiotics with their side effects. I just brought to your notice. Fluoroquinolones, this is also a very important question. The common adverse effect that is associated with fluoroquinolones is tendon rupture. Okay, fluoroquinolones are mostly associated with the side effect of tendon rupture. This is very, very important. Okay. And also penicillins, yeah, hypersensitivity, reactions, vancomycin, Redman syndrome, chloramphenicol, Grayman syndrome, anything. Okay, all these things are important adverse effects of various antibiotics. Yeah, you can take a picture or screenshot if it is needed. Yeah, next. What is the mechanism of action of clopidogrel? Okay, here the question is about clopidogrel. Which kind of a drug is it? It is a antiplatelet drugs. Okay, this is about the antiplatelet drugs. What is the mechanism of action of clopidogrel? It inhibits COX-1, inhibits P2Y12 ADP receptor on platelets, inhibits thrombin, activates plasminogen. So what is the right answer for this? What is the right answer? Yes? Yeah, it inhibits the P2Y12 ADP receptor on the platelets, clopidogrel. Yes, next slide please. Here we will see a quick classification: fibrinolytics, antiplatelet drugs. Okay, antiplatelet drugs, so fibrinolytics and antifibrinolytics. Okay, fibrinolytics, they are also known as plasminogen activators. Okay, we have plasminogen activators in fibrinolytic drugs. Okay, like alteplase, retiplase, tenecteplase, etc. These are all known as plasminogen, tissue plasminogen activators, TPS. Okay, all these drugs are known as TPS, tissue plasminogen activators, and also certain like clopidogrel, ticticlopidine, etc. and GP receptor blockers, GP antagonists, okay, abscimab, tirofiban, etc. Next. Yeah, so this is when these are various antiplatelet agents and their mechanisms of action, their target site and their mechanisms of action. Next. Yeah, which drug is contraindicated in pregnancy due to the risk of teratogenicity? Yes, very important question again. Which drug is contraindicated in pregnancy due to the risk of teratogenicity, especially limb defects? Folic acid, methotrexate, paracetamol and insulin. What is the right answer? What is the right answer? Okay, folic acid. Is it contraindicated in pregnancy? No, it is widely used in pregnancy. Yes. Yeah, the right answer is methotrexate. Option B, methotrexate. Folic acid. Will it be so? Even if you are not sure about the answer, so here in such type of questions, even if you are not sure, you really don't know the contraindications or you don't know about the effects of methotrexate. Okay, then go for elimination. You want to answer this question, then you go for elimination method. Okay, contraindicated in pregnancy, they told. The question is about. So folic acid. So no one on this earth can say that Folic acid is contraindicated in pregnancy because it is most widely used in the first trimester and also before pregnancy. Okay, so folic acid is an important nutrient which is regularly used during the pregnancy. Okay, and the next option is paracetamol. Okay, and I think like if paracetamol is contraindicated in pregnancy, no one on this earth would get pregnant further. No one would plan for pregnancy because paracetamol is most widely used. We all slightly there is a rise in temperature immediately. Yeah, take one paracetamol, right? So if paracetamol is contraindicated, the earth will go numb. Okay, zero population, right? Next is insulin. Insulin also is not contraindicated in pregnancy, so we all know because most of the times there is gestational diabetes. Most of the people they undergo gestational diabetes, and insulin is prescribed. Insulin is one of the drugs of choice in gestational diabetes. That is the diabetes which occurs during the pregnancy. Okay, so even that is not contraindicated. The remaining option is methotrexate. Whether you don't know its effects, okay, you don't know what effects it is causing, but here you can choose that option. Okay, that's one of the elimination methods. Next. Okay, moving forward to the next question. Which of the following drugs can precipitate hemolytic anemia in patients with G6PD deficiency? Okay, what is G6PD? What is G6PD? Glucose 6-phosphate dehydrogenase. It is an enzyme. Okay, one of the most prominent enzymes, dehydrogenase oxidoreductases. Okay, G6PD is nothing but glucose 6-phosphate dehydrogenase. So, when that enzyme is deficient, there are many diseases associated with G6PD deficiency usually. So, in G6PD deficiency, which of the drugs can be contraindicated or which can precipitate hemolytic anemia is the question. It is very important question again. Paracetamol, ciprofloxacin, primaquine and omeprazole. Okay, and the right answer is primaquine. Okay, there are many drugs. The next slide. Can I go to the next slide please? Yeah. There are many drugs, many classes of drugs that are contraindicated in G6PD deficiency because they precipitate, because they cause hemolysis. G6PD deficiency will lead to hemolysis because of certain drugs. Okay, like we have several analgesics, antimalarials, antibacterials and some other drugs like antiarrhythmics, also quinine. Okay, quinine, quinidine, antiarrhythmic agents also, they cause hemolytic anemia in G6PD deficiency. Okay. Yeah, which drug interaction occurs? Again, question from drug interactions. Okay, which drug interaction occurs between rifampicin and oral contraceptives is the question. A, increased contraceptive effect, no interaction. C, rifampicin decreases the contraceptive efficacy and increased risk of bleeding. So, what is the right answer? So first what we have to do, increased risk of bleeding we have to eliminate. Okay, because rifampicin and oral contraceptives, they are both not related to bleeding anyway. Okay, so first eliminate that option. Okay, so rifampicin decreases the contraceptive efficacy of oral contraceptives if they are used together. Why? So what exactly is the interaction here? What is the exact interaction that happens here? Rifampicin, what does it do? What does it do? So, in the previous the question we have discussed about cotrimoxazole and warfarin. We have discussed about enzyme inhibition, and here rifampicin, it is an enzyme inducer. Rifampicin, what it does? So, because it is an enzyme inducer, what is it doing? It is decreasing, it breaks down. Enzyme inducer means what it does? It induces the metabolizing enzymes. It increases metabolism. Once enzyme metabolism is induced, there is an increased metabolism. So, because of higher metabolism, these oral contraceptive agents, they get broken down. Okay, they get metabolized before executing or before exhibiting their pharmacological activity. Okay, that is the reason because why rifampicin and oral contraceptives are contraindicated, because they have this interaction, because of the interaction of enzyme induction. Okay, so there we have seen when there is an enzyme inhibition. Okay, this is also a ground rule. Whenever there is especially with respect to metabolism, whenever there is an enzyme inhibition, there is an increased activity. enzyme inhibition is there. So there is it resulted in increased activity of warfarin. Here there is an enzyme induction. Enzyme induction decreased activity. Okay, whenever there is enzyme induction, the activity will decrease, and there is an inhibition, there is an increase in the pharmacological activity. Okay, moving forward to the next question. Which of the following is a common side effect of long-term corticosteroid therapy? What is it? Hypoglycemia, adrenal suppression, weight loss, hypotension. Long-term corticosteroid therapy, what it does? It causes adrenal suppression. That is the most common one, because corticosteroids, yeah, they are produced from the adrenal glands, and so what they do, it will cause adrenal suppression. Long term use, definitely it causes adrenal suppression. Yes. Yeah. Which drug is associated with tardive dyskinesia with long term use? The drug that is associated with tardive dyskinesia with long term use. Okay, and our options here are acetylcholine, haloperidol, diazepam, and lithium. And lithium. What is the right answer? For tardive dyskinesia. Tardive dyskinesia is nothing but some involuntary movement. It is a neurological disorder. Okay, tardive dyskinesia is a neurological disorder. Involuntary movements, which is associated with dyskinesia. Kinetic is nothing but some movement. Dyskinesia means improper movement, involuntary movements. Okay, is associated with lot. Yeah, there are again so many drugs that are associated with tardive dyskinesia. And the right answer here is haloperidol. Haloperidol belongs to the class of what? Haloperidol, it belongs to the class of, so we have to remember here, so tardive dyskinesia is one of the effects of EPR. Okay, tardive dyskinesia is one of the EPR, that means extrapyramidal effects, EPS, or extrapyramidal reactions or extrapyramidal effects. Okay, EPS or EPR, they are called as extrapyramidal effects, which are usually caused by antipsychotics. Extrapyramidal effects usually caused by antipsychotics. Okay, so haloperidol here, it is an antipsychotic agent. Okay, next. So what are the medications that are usually associated with tardive dyskinesia? Antipsychotics, yes, typical and atypical. So less with typical and more with atypical. Antiemetics, antidepressants, antihistamines. So there are many drugs that are associated with tardive dyskinesia. The next slide, please. Can I have the next slide, please? Yeah. Antipsychotic drugs. Yeah, usually antipsychotic drugs, atypical and typical antipsychotics. Atypical antipsychotics, they cause more use of, or they cause more chances of these extrapyramidal effects. Okay, extrapyramidal symptoms or extrapyramidal effects, EPR, they are most prominently they are caused by atypical antipsychotics than typical antipsychotics. Okay, yeah, next one, please. Moving to the next question, which of the following drugs is contraindicated in angle closure glaucoma? Okay, the drugs that is contraindicated in the angle closure glaucoma. Yeah. Pilocarpine, atropine, timolol, and latanoprost. Which is the right answer here? Atropine. Okay, atropine is contraindicated in angle closure glaucoma. Next slide, please. Yeah. So we can see here about glaucoma. So we all know that glaucoma. Why do glaucoma occur? Increase of aqueous humor. Okay, increased aqueous humor will cause glaucoma. We are very familiar with that. So all the remaining drugs like pilocarpine, timolol, latanoprost, what they do? They reduce the intraocular pressure. Okay, all of them, they reduce the intraocular pressure, so they can be used in angle closure glaucoma. Okay, but whereas that is this atropine is used only. Atropine is also used in glaucoma, but it is used only in open angle glaucoma. Okay, it is not used in narrow angle glaucoma. It is only used in the open angle glaucoma. Okay, atropine is contraindicated because what happens? It increases the intraocular pressure. It usually increases the intraocular pressure, so it is contraindicated in narrow angle or angle closure glaucoma. Next question, please. Yeah, which drug causes synchronism as a side effect? Yeah, this is also very prominent, important question. Very important question again. Which drug causes synchronism as a side effect? Quinine, chloroquine, doxycycline. These all look similar, something like chloroquine, mefloquine, all these things, they look similar. So all of them, do they cause synchronism? Yes? No? Okay, so Ivan, what we think, there are so many drugs, they are similar, so they do not cause synchronism. Doxycycline is not similar, then it causes synchronism. No, it's not like that. Okay, so quinine and quinidine are the drugs that cause synchronism usually. Okay, so that is the reason quinine is less used as an anti-malarial. That's why we have gone for primaquine, chloroquine, all these drugs are used because of the reason it causes synchronism. Next slide, please. Yeah, so synchronism, what it usually, it is caused due to the overdoses of quinine, quinidine. Okay, so which are obtained directly from the natural sources. Okay, what happens? It has a flushing skin. Okay, tinnitus. Tinnitus is also, this is also one of the important questions. What is the common adverse effect associated with quinine? Tinnitus. Tinnitus means something which tinny means related to ear, which has a ringing sound in the ear. Tinnitus is the side effect of quinine. Okay, quinine and quinidine. Okay, and also blurred vision. These are all the various features of synchronism. Next, please. Yeah, which of the following is a major toxicity of methotrexate? Methotrexate. The major toxicity of methotrexate: pulmonary fibrosis, bone marrow suppression, hepatotoxicity, and all of the above. Yes, which one? Yeah, so constantly going with the flow, because there is an all of the above. No, don't always go with the flow. Sometimes I told you need to rethink. Yes. Next slide, please. Yeah, methotrexate. We have a mnemonic for the side effects of methotrexate. Metho. Okay, the term itself, metho. M for mucosal damage, E emesis, T thrombocytopenia, H hepatotoxicity, and O is lung fibrosis, along with bone marrow depression and all. Okay, so these are the adverse effects of methotrexate. Next. Yeah, and so this completes questions from pharmacology. Okay, till here we have gone through questions from pharmacology, and the next will be human anatomy and physiology. There are limited questions from human anatomy and physiology. Which of the following, but very important question, which of the following valves prevent the backflow of blood from left ventricle into the left atrium during ventricular contraction is the question. And options are A, aortic valve, B, pulmonary valve, C, tricuspid valve, and D, mitral valve or bicuspid valve. What's the right answer? Right answer is nothing but mitral valve. So we all know that very well. So we have 4 valves in our heart. Okay. Heart consists of 4 valves. They belong to 2 different categories. One is the AV valves. AV valves are nothing but atrioventricular valves. AV valves nothing but the atrioventricular valves, nothing but what are they? The tricuspid valve and the mitral valve or the bicuspid valve. And next is the semilunar valves. The semilunar valves, they include the aortic valve and the pulmonary valve. So these are the 4 valves that guard our heart and that are present in the heart for the proper circulation. Okay, so next slide please. Yeah. So mitral valve, coming to the bicuspid valve. Bicuspid valve is present on the left side. Okay, it's left atrium and the left ventricle. Okay, because it separates left atrium and the left ventricle, what usually happens? So it prevents the flow. What is the function of these valves especially? It prevents the backflow of the blood. Okay, they only ensure the forward flow. They prevent the backward flow. Okay, and tricuspid valve is present on the right side. It is present between the right atrium and the right ventricle, prevents ventricle to the right atrium. Aortic valve, which separates the left ventricle from the aorta. Aortic valve is also present to the left side. It separates left ventricle from the aorta. Okay, what is aorta? Largest artery. Okay, aorta is nothing but the largest artery which supplies oxygenated blood to the arteries and arterioles. Okay, and next is the pulmonary valve, which separates the right ventricle and the pulmonary artery. What is the function of pulmonary artery? Pulmonary artery, it carries, what does it carry? Deoxygenated blood. It carries deoxygenated blood to the lung for purification. That is the only artery, pulmonary artery, it carries deoxygenated blood to the lungs for purification. Okay. So, and this, there is a very quite significant, these two types of valves are quite significant. Atrioventricular valves and semilunar valves, these are quite very significant in terms of heart sound and heartbeat and heart sound also, because the first sound of the heart is nothing but lump. Okay, the first sound of the heart, lump, is produced. When is it produced? By the closure of these AV valves. By the closure of these AV valves. Atrioventricular valves, when they close. When they close, what happens? When they close, the lump sound is produced. It starts the ventricular contraction. It indicates the start of ventricular contraction. Start of ventricular contraction. And next sound is dub. The second sound is dub. Dub is produced because of what? Because of what? The closure of these semilunar valves. The closure of these semilunar valves. Okay, it is the end of ventricular contraction. So these two sounds are nothing but they indicate the start and end of the ventricular contractions. Okay, so this is about the various valves. And the next question, the primary site of nutrient absorption in gastrointestinal tract. Okay, in gastrointestinal tract, what is the primary site for nutrient absorption? So we all know that the absorption procedure mostly happens in the stomach. No, it is small intestine. Okay, stomach is not much involved in the absorption process where it starts, but the absorption is completely, it occurs in the small intestine. But, so we can eliminate stomach here and the remaining duodenum, jejunum and ileum. Duodenum, jejunum and ileum. So what is the major site of absorption? Jejunum. Okay, so we have to remember, very important question. This is again next slide please. So you can see next. Yeah, can you please have the door closed? Yeah. So duodenum, it does usually, what happens in the duodenum, there is a neutralization of acids. Okay, whatever the food that is received into small intestine from the stomach, it is just neutralized at that place. Okay, and the actual chemical digestion and absorption, nutrient absorption happens in occurs in the jejunum part. Okay, and ileum, it carries this digested or the absorbed food, it carries to the next part, that is the large intestine. Okay, next. Yeah, in the human body, the hormone insulin is produced by which type of cells in the pancreas? Very important question again. Very easy, very important. A, alpha cells, B, delta cells, C, beta cells, and D, acinar cells. What's the right answer? Beta cells. So we all know that, right? Pancreatic cells which produce hormones are known as pancreatic cells that produce hormones. Various hormones are known as islets of Langerhans. They are known as islets of Langerhans. Pancreatic cells, that is islets of Langerhans. There are different types of cells like alpha cells that produce glucagon, beta producing insulin, delta cells producing somatostatin, and F cells or polypeptide cells which produce the pancreatic polypeptide. The previous slide once please. So what about alpha, beta, delta is okay. What about acinar cells? What is the function of acinar cells in pancreas? Acinar cells in pancreas? Acinar cells, they secrete the enzymes. Whereas islets of Langerhans, they secrete the hormones. In the same way, acinar cells, they secrete there are two types of cells in pancreas, acinar cells and islets. Okay, out of these acinar cells, what they do? They secrete the enzymes, various pancreatic enzymes, pancreatic lipase, peptidase, etc. Many things. In human body, next question please. Yeah, next. Yeah, which neurotransmitter is primarily involved at the neuromuscular junction to initiate muscle contraction? A very important question once again. At the neuromuscular junction, which initiates the muscle contraction? Which one? Dopamine, serotonin, acetylcholine, norepinephrine. What's the right answer? Acetylcholine. Yes. Acetylcholine is the neurotransmitter that is involved at the neuromuscular junction, that is synapse. Okay, to initiate the muscle contraction. We will see about various neurotransmitters. Yes, we can just go through. In this also it is mentioned acetylcholine. Just now we have discussed about myasthenia gravis. Okay, in myasthenia gravis, what did we discuss? When there is a decreased uptake, when the acetylcholine is not properly uptaken, or when there is a decreased uptake, decreased activity of acetylcholine, muscle activity is not proper. That means acetylcholine itself is responsible for the muscle activity. Right? And there are also various other neurotransmitters, adrenaline, epinephrine. We are running short of time. So please make a note of these. The next one. Yeah. Which of the following is a lyophilized dosage form? Question from Pharmaceuticks once again. Which of the following is a lyophilized dosage form? Tablet, injection, freeze-dried powder for reconstitution, and ointment. Okay, tablet, injection and ointment cannot be lyophilized. Lyophilization is nothing but freeze-drying. Okay, the term lyophilization, it is nothing but it indicates freeze-drying. Nothing but freeze drying. Okay, next question please. Can I have the next question? Yeah. The main purpose of coating tablets is to mask the bitter taste, improve appearance, protect from moisture, and again all of the above. What could be the answer? Yes, here it is again all of the above. Okay, definitely that is the reason we coat the tablets. Yeah, which of the following is used as a binder in wet granulation? Very interesting question here. Which of the following is used as a binder in wet granulation? Lactose, polyvinyl pyridine, magnesium and starch. Yeah. So here we can eliminate two options. What are they? A. Lactose. Lactose is a diluent or a filler. Eliminate. Magnesium stearate, it is a lubricant. Eliminate again. Okay, and we have two options. What are they? PVP, polyvinyl pyridine, that is nothing but povidone, and starch. So both of them can be used as. Is starch not used as a binder in wet granulation? Don't we use starch as a binder in wet granulation? So the logic here is, it is not starch paste. If it is starch paste, yes, definitely you can use it in wet granulation. Starch solution or starch paste, yeah, definitely you can use it in wet granulation. But only the individual term starch, okay, it indicates so many. Starch is used as a disintegrant, it is used as a diluent, it is used as so many. Okay, so you can't categorize it under binder exclusively. If it is starch based, yes, definitely that will also be a right answer. So PVP is an organic binder. Inorganic binder, sorry. Next. Important question again. Which of the following drugs inhibits topoisomerase 1 by stabilizing the DNA topoisomerase 1 complex, leading to DNA strand breaks during the replication? Yeah. So topoisomerase 1 inhibitor. Here the question is about the topoisomerase 1 inhibitor. Okay, just remember that. That's it. Don't go on digging deep into this question. Okay, you can dig deep, that is right. But topoisomerase 1, it is clearly mentioned. So according to the time, you just cut short the question, decode the question to be topoisomerase 1 inhibitors. Etoposide, doxorubicin, irinotecan and mitoxantrone. There is only one drug that is a topoisomerase inhibitor among this, right? And then go through options. Only one topoisomerase inhibitor is there, that is nothing, irinotecan. Okay, next. Yeah, topoisomerase 1 and topoisomerase 2. So in topoisomerase, what it does, it cuts only one strand, and topoisomerase 2, it cuts two strands. Here, next slide please. One inhibitor, irinotecan. Yeah, a patient with metastatic melanoma is started on an immunotherapy. This question, soon after we see this question, we will go down. Most of us. Yeah, even I am not exclusive, right? So most of us go down. This question is so very descriptive. The patient will start metastatic melanoma, started on immunotherapy. PD-1 receptor on T cells. That is enough. Okay, it may be metastatic melanoma, myeloma, whatever may be the noma. Okay, whatever it might be, but you only have to concentrate on what block PD-1 receptor, because out of whatever the options given here, there is only one drug which is a PD-1 receptor inhibitor. There is only one particular drug which is a PD-1 receptor inhibitor on T cells. Okay, so that's all is enough for us. Okay, so ipilimumab, nivolumab, rituximab and brentuximab. Okay, out of this the PD-1 receptor inhibitor is nivolumab. Okay, and what about the remaining drugs? Ipilimumab. What about, yeah, ipilimumab? It is CTLA4. It is a CTLA4 inhibitor, same on T cell. CTLA4 inhibitor on T cells. Okay, and rituximab? What about rituximab? CP20. It is a CP20 inhibitor on B cell. It does not work on T cell. Rituximab, it works on B cells. Okay, and brentuximab? What about brentuximab? Yeah, it again acts on CD30. It again acts on the CD30 receptor. So why I am explaining all these things is, here out of these so many options, there is only one drug that fits to PD-1 receptor. So only go with that. It may be whatever may be the melanoma or immune response, all these things we don't need to worry. We are not worried about all those things at that point of time. Later after the exam we can think about all these things, but at the point of examination only think in a decode the question and then answer the question. Okay, so this completes the questions from Pharmaceutics, Pharmacology, Human Anatomy and Physiology, and the remaining part of the discussion will be continued by Sir. Yeah, thank you all very much for your patient listening and watching. Please do continue watching us. Thank you.
Okay, so we restart again. So with the chemistry questions and some of the health education and community pharmacy questions, and also some drugstore business management questions, especially related to pharmacist AIIMS. Okay, these are the questions we will discuss, and not only subject, we are also going to discuss about general questions. Okay, these are the very important, because whatever the questions we are going to explain in this exam, and that are the repeated questions in all the common entrance exams in pharmacist and RRB and ESI, other pharma competitive exams. Okay, so please patiently listen all this live discussion, and this will help you. There are so many direct questions from our YouTube channel and our lessons. So I hope this will help. So coming to the question, chemistry questions, which functional group is responsible for the acidic nature of aspirin? देखो ये एस्पिरिन और पैरासिटामोल से बहुत सारा repeated questions are in pharmacist. Okay, that is in RRB and AIIMS may be these analgesics, because these are the drugs, common OTC drugs, and they focus much in this area, aspirin, paracetamol. So let us deep dive into the chemistry of this aspirin and paracetamol. Next question is on paracetamol and this question is on aspirin. So यहाँ पे देखते हैं ester, amide and carboxylic acid, phenylcoH. So these are the common groups in analgesics. Okay, NSAIDs. So यहाँ पे what is the answer? What is the answer? Can you answer this question? Because very common but very confusing. So and so many times, बहुत सारा times they ask in the examination. So the answer is carboxylic acid. So here the carboxylic acid group will give the acidic nature to the aspirin. Acetyl salicylic acid. The acid का नाम इसलिए आता है this particular carboxylic acid. Okay, so try to understand the chemistry of the aspirin. So salicylic acid get converted into aspirin in the presence of acetic anhydride. So these sometimes they ask intermediate. Don't go into deep of chemistry other drugs. I'm not telling. So only major drugs, जो भी paracetamol है, aspirin है, इसके ऊपर they will ask question in the pharmacist. Right? These are a repeated question. And यहाँ पे देखते हैं this another phenylcoH group है. This is the only this is converted into ester and there is no involvement in the acidity of aspirin. That is phenylcoH. And the only important group is carboxylic acid group, which will give the acidic nature to the aspirin. Coming to the next question. The next question is IUPAC name of paracetamol. बहुत simple. Every pharmacist must know this information. अब बहुत सारे लोग जानते हैं डोलो 6 में पैरासिटामोल है, but when you sit in the examination you will surprised to see these type of questions, and this is a repeated question in RRB pharmacist, right? So what is the answer? So बहुत सारे लोग क्या देखते हैं पैरा अमीनो फिनाल है, तो बहुत सारा टाइम से सुना है. No, that is a wrong answer. The right answer is 4-hydroxyacetanilide. Okay, so this is the important question and general question, general OTC drug. You must remember the chemical name of the paracetamol. See the similar structure of paracetamol. Acetanilide, this is the starting material for paracetamol, and the same similar structure for the phenacetin. And these two are the similar structures. Okay, and let's go to the synthesis of paracetamol. देखते क्या है इसका starting material. Nitrobenzene से in the presence of zinc and ammonium chloride it will convert into phenyl hydroxylamine, and then finally para-aminophenol, then paracetamol. These don't remember all the synthesis of NSAIDs. Just remember aspirin and paracetamol. Very, very important, right? The starting material is nitrobenzene and the intermediate is acetic anhydride. Important is intermediate, and finally we will get paracetamol 4-hydroxyacetanilide. Next question. Which analytical technique is best suited for determining the molecular weight and structural fragment of a drug? So structural fragment of a drug and molecular weight कौन सा method से हम determine कर सकते हैं? This is the question, very basic question. This is related to analysis and also chemistry and also even pharmaceutics also, right? So यहाँ पे दिया हुआ UV spectroscopy, IR spectroscopy, mass spectroscopy, NMR. So हम सब लोग जानते हैं UV किस लिए देते हैं? UV किस लिए? क्वांटिटेटिव मेजरमेंट, उसमें हाई कितना है, क्या है. सो एंड IR क्या देते हैं? So these are the common techniques in the analytical techniques which are used in the pharmaceutical industry. So what is the answer? The answer is mass spectrometry, right? So with this we will get to know the structural fragment and molecular weight of any molecule, any chemical molecule. We will get the molecular weight. And if you go to the next, so if you see the other methods, so UV visible से क्या we will find out the quantitative, okay, and IR से we will find out the structures, कौन सा functional groups है इसमें. हम IR में रविशंकर बुक अगर आप देख लिया तो उसमें IR का एक टेबल रहता है, उसमें से कंपलसरी क्वेश्चन और टेबल में से कार्बोनिल ग्रुप का क्या रेंज है, क्या वेवलेंथ है, OH का क्या है, नाइट्रोजन का क्या है, वो that table will give you marks for any examination, drug inspector and pharmacist. Remember the table, right? And that IR will give you the structural element. Mass will give you, as we discussed, it will give you the structural information, and also it will give you the molecular weight. And come to the NMR, okay, nuclear magnetic resonance. This is also a very important technique, and it will give complete 3D structure of the information. क्या क्या है उसमें, and these are the basis of analysis: UV, electronic transition, you know, Beer-Lambert's law, and higher spectrum molecular vibrations, and mass spectrometer mass to charge ratio, F/Z ratio, right? These are the main basis of analysis of all these important techniques, very very important. And next, the presence of beta lactam ring in key structural features, very simple question, and it will repeat in every examination, right? अगर बीटा लैक्टम रिंग आपके दिमाग में आए तो आपको याद होना चाहिए, that is penicillins. पेनिसिलिन किसने आइडेंटिफाई किया, किसने किसने डिस्कवर किया पेनिसिलिन ने? These are all important basics of the penicillin you must know. Okay, Alexander penicillin कब किया? 1928. कैसे किया, right? So he went for a marriage and suddenly he came after 1 week, and then he saw some inhibition, zone of inhibition at the agar plate. Then finally he took that agar plate, जाके NMR देखा, उसमें से penicillin मिला, right? In this way you must remember the chemistry and some of the information in a blind manner, right? No need to mug up, no need to memorize all those things. Okay, you must answer these kind of questions. Penicillin से हर exam में एक question रहता है, right? And next, so these are the other drugs like macrolides में क्या ring होता है? It contains 14 to 16 member ring. Macrolide ring is a very macro, it's a very big, okay? 16 rings होता है, 16 member ring उसमें रहता है. And then tetracycline में क्या होता है? Naphthalene ring, okay? Naphthalene ring, these are the core rings present in the drugs. You must remember the important drugs in chemotherapy and the ring present in it, right? It will give you weightage because no one will read this much deep, but if you are memorizing the important drugs of the rings, you will get selected in any examination. And penicillins, everybody knows, beta lactam, aminoglycosides, yes, it contains aminocyclitol ring, right? And then tetracyclines, so tetracyclines में naphthalene ring होता है, right? So these are the important antibiotics. You must remember the core ring which present in it. And coming to the another important question, as I am discussing IR table. IR table में हर exam में एक question होता है पक्का, right? And these are the important group is CO and NH and OH. इस तीनों में बहुत सारे exam में repeat किया, right? AIIMS में and Pharmacist में, and then GPAT, NIPER, drug inspector. Only you must remember only few group which repeatedly asking CH, OH, NH, right? So these are the major, right? And here we will see the CO, carbonyl group ka what is the wavelength, and you remember that you stick the table in your home or in your hostel room, it will give you 2 marks or 4 marks, whatever. If it is AIIMS, it will give you 4 marks, right? So what is the answer here? 1700, okay, 1700. And here you must remember the other groups also, like OH or NH 3300, right? CH 2900, 1700 CO, and the lowest one is C single bond O, that is 1050. This is stretching, right? And then it is very strong. The single जैसा low जाता है वो बहुत peak strong होता है, right? And examples alcohol, ethers and esters. So this is the table. Please note it down properly. इसमें से compulsory आपको question आएगा and you will get the marks. Those others unable to attend the question. Right. Next question. So which of the following drug is synthesized via Hans pyridine synthesis? A बहुत very rare question है. But if you are remembering few important drugs and their models, कुछ drugs को है ऐसा models. If you remember, then you will get the advantage of on others, right? So nifedipine, diazepam, ciprofloxacin, and sulfadizine. So harsh pyridine synthesis. The right answer is nifedipine. And देखते हैं other drugs के क्या क्या है. So then you must remember the drug ring. मैं क्या chemistry core ring क्या है उसमें, और important drugs का IUPAC name, and then what is the main synthetic method, right? So here nifedipine, as we discussed, Hodge synthesis, so condensation of aldehyde plus beta ketoesters, and diazepam. This is another important mother drug of diazepam, right? You must remember the chemical name of diazepam, IUPAC name, and starting metal, because diazepam से बहुत सारा drugs, lorazepam आता है, nitazepam आता है, ये पूरा drugs उसी से है. This is the mother drug. जैसा कोई भी मदर ड्रग है उसका केमिकल नेम याद रखना, एंड देन उसका स्टार्टिंग मटेरियल, राइट, एंड उसका स्ट्रक्चर, कोर रिंग क्या है उसमें, राइट? डायजेपम में बेंजोडायजेपिन क्लास है, राइट? इट इज अ साइक्लाइजेशन ऑफ अमीनो एसिड प्लस मैलोनाइट्राइट, राइट? रिंग, एंड देन सिप्रोफ्लॉक्सिन. कमिंग टू सिप्रोफ्लॉक्सिन, इसमें क्या रिंग होता है? फ्लोरोक्विनोलोन. ओके, फ्लोरोक्विनोलोन already you are discussed in the pharmacology, mechanism of action, उसका side effects, but in the chemistry point of view you must remember the chemical ring present is it? Okay, fluoroquinolone, right? And it involved multiple step synthesis from anthranilic acid. And then the key reactions are fluorination, cyclization, and piperazine. So these are the main key points about ciprofloxacin. And then another one is sulfatizine, sulfonamide, condensation of sulfonate chloride, and diaminopyrimidine. Right? This is nucleophilic substitution reaction. Next question, the pharmacophore of benzodiazepines. Again benzodiazepines. Again we repeated benzodiazepines because this is the compulsory question in the examination. Diazepam, aspirin, paracetamol, and जो mother drug होता है आप drug में और category में, that is very very important. You focus on morphine, right? So these kind of mother drugs are very important. And benzodiazepines include which of the following structural features? Beta lactam, हमको पता है penicillin है, thiazole ring, fused benzene and diazepine ring, and quinolone ring. So diazepine ring, very simple. Next question. So these are the different rings present, and some examples already you know that if you know the classification, you will answer many questions. Next. And which analytical method used to determine the enantiomeric purity of chiral drugs? Gas chromatography, HPLC, UV spectroscopy, conductometry. Enantiomeric purity of chiral drugs, right? The right answer is HPLC. So here we use HPLC to get to know the information about enantiomeric purity of a chiral drugs. Next. And the reaction of sulfonamide with pyridine and cupric sulfate gives a green bluish color, and this is known as कुछ important tests है, Ninhydrin test, बहुत सारा exam में repeated question है, and Muraxide, and these kind of important tests you must remember always, right? So what is the test here? The answer is Muraxide, Ninhydrin, copper sulfate, or sulfur drugs, and ferrichloride test. So bluish color, greenish blue color, so it will give copper sulfate. Copper sulfate हमेशा blue color में होता है, right? If you remember that thing, then you will easily answer these type of questions. Next, yeah, these are the important tests. Muraxide test. What is the reagent? Muraxide plus sodium hydroxide. The color is purple and violet. Example of drugs: caffeine and theophylline. Okay, caffeine and theophylline identified by Muraxide drug. And next, L-dopa captopril. These are drugs identified by Ninhydrin test. Very very important in biochemistry, in pharmacology, in medicinal chemistry. This Ninhydrin test is very important, right? Next, copper sulfate, we know blue color, and the sulfatizine and sulfathiazole because it contains sulfate, right? Next, ferrichloride test, the salicylic acid and phenol. Okay, ferrichloride solution. Next question. Coming to the jurisprudence, very very important. Pharmacy, Drugs and Cosmetics Act. Okay, so many direct questions will come. So Pharmacy Act enacted in 1948. The direct question, right? So this slide will give you pakka 1 mark in your upcoming examination, right? So important. So previous AIIMS CRE में they asked about Drug and Magic Remedies Act question. Okay, when it is established, when it is enacted, that is 1954. This is a repeated question in every, and this slide will give you 1 mark in any exam. So coming to the Narcotic Drug and Psychotropic Substances Act is 1985, the rules and DPCO 1995, DC Act 1940, and Essential Commodities Act, Drug Inspector 2022, repeated question. And in Drug Inspector 2022 Telangana mein, they asked complete questions on Narcotic Act only. They have not asked a single question from DC Act. So that's why please remember this slide information. You will get 1 question. And Minimum Wages Act 1948, Factories Act 1948, right? And National Pharmaceutical Policy Act 2002. So these are the important acts in all drugs and cosmetic rules, right? Next, pharmacy. Then which schedule drugs DC Act contains list of drugs require special prescription format cannot be refilled without any prescription. अगर न्यू प्रिस्क्रिप्शन नहीं है तो ओल्ड प्रिस्क्रिप्शन से इस प्रिस्क्रिप्शन देके ड्रग्स नहीं दे सकते हो. कौन सा ड्रग्स है? शेड्यूल एच, शेड्यूल एक्स, शेड्यूल पी, शेड्यूल वाई. सो जो भी शेड्यूल एक्स ड्रग्स है जैसे स्लीपिंग पिल्स है, राइट, लाइक व्हाट आर द स्लीपिंग पिल्स? डाइजेपम्स, स्पेशली डाइजेपम, लोराजेपम, नाइट्रोजेपम. सो दीस टाइप ऑफ ड्रग्स आर मॉर्फिन रिलेटेड ड्रग्स, राइट? So those are analgesic, narcotic analgesic. These drugs cannot be prescribed until unless they have new prescription. That is Schedule X, very important. So these are some of the examples for Schedule X drugs. Remember, these are very very important. Amobarbital, amphetamine, barbital, cyclobarbital, dextroamphetamine, Alright, glutathione, ketamine, okay, meprobamate, methylamphetamine, and tramadol. Tramadol also very used, commonly used drug in the medical shop. So especially in the hospitals. Okay, tramadol injection agar आप दे रहे हैं, tramadol tablet आप दे रहे हैं, you must have a new updated or recent prescription. Otherwise, you cannot prescribe tramadol, right? And it should contain XRX. The prescription must contain XRX, right? Next. And what are the other important scheduled drugs? It should contain the label, Schedule H. So common question repeated in the examination, Schedule H, not to be sold by retail without the prescription of a RMP, registered medical practitioner. Coming to the Schedule G, disease of ailments, right? So prescription of drug caution, it is dangerous to take this preparation except under medical supervision, right? These three are important, Schedule H, X, H, G. So labeling is very important. And all the boxes of the injections or tablets, it should mention, Schedule H should mention properly, Schedule X should mention properly, and Schedule G should mention properly. Right, next. The Drugs and Magic Remedies Act in 1954, already we discussed, this is very, very important. The next question. So 1954, this is the act, completely I have taken from the main act, main pharmacopoeia. So Drugs and Magic Remedies Act in 1954, right? So next. Yeah, this is very, very important question. Misbranded, spurious, right? उसका definition क्या है? Drugs and Cosmetics Act, this question is repeated in every examination. Misbranded, what is misbranded? What is spurious? कौन सा section में आता है? Right? These kind of questions you must remember. So misbranded will come under section 17. Spurious will come under section 17B. Okay, so these are the very famous terminology in the Drugs and Cosmetics Act rule, and you must remember information in detail. So section 10 क्या होता है? So prohibition of import of drugs and cosmetics. So import, prohibition of import of this section 10, right? Next, section 17B, as I already explained, spurious drugs, section 17B में, section 17 में only misbranded, section 17B is spurious, right? Next, and section 12 क्या होता है? Power of the central government rules to make DC Act, to rule, to amend the DC Act, it will come under section 12. So these are the important sections you must remember. And another important question, Schedule M. Okay, this is very, very important. Why? Because nowadays CDSCO and drug inspectors and pharmaceutical industry focusing on GMP. Everything they are asking, documentation, and even hospitals also they are asking these kind of requirements by the government regulatory authorities, right? So that's why Schedule M is very, very important. And what is M1, M2, M3, and again there are two parts in Schedule M. So what is that? Good manufacturing practices. This is M1. Important homeopathic preparation. M2, manufacture of cosmetics. Second, cosmetics. Okay, so M2 cosmetics, M3 medical device. Important. M1, M2, M3. अगर in detail में आप गए तो so part 1 में क्या है, part 2 में क्या है. Next, so again there are divided, Schedule M divided to two parts. Part 1 is related to premises and material. Part 2 is related to plant and equipment. Very, very important. अगर इस type का question expected in this upcoming examination in detail. Okay, so again in part 1 there are again A, B, C, D, F, right? So please go through this slide, and because Schedule M से expected है question, right? हमेशा Schedule M is always important for all the competitive examinations in pharmacy. Next question. So which of the following is a primary prevention strategy in community health? What is the, these are the community health questions are very common and general questions will come, but based up by looking at the options you can eliminate. So blood pressure screening for early detection and hypertension, providing insulin in diabetic patient. Okay, so measles vaccine to a child. So community way. Okay, so we will see the different levels of prevention. So first, and then first prevention step is primordial, where we can educate the large population. That's the first primary prevention and basic prevention, primordial prevention it is called. And second is primary prevention. So primary prevention we can do by vaccination. Okay, and then health promotion. उसको न्यूट्रिशन कैसे कंज्यूम करना है वो, if you do that health promotion, obviously you will prevent the diseases. And secondary prevention is early diagnosis and prompt treatment. Once if it diagnosed, you have to treat the patient in early stage. That is a secondary prevention. And tertiary prevention, disability limitation and rehabilitation. You go to hospital, corporate hospitals or big hospitals, you admit and you get done the surgeries. These are the levels of prevention. Next. In community pharmacy, the main objective of the patient counseling is, patient counseling का main objective क्या है? Increase pharmacy sales? No. Ensure proper use of medication and improve adherence and replace physician's advice? We cannot do that. And prescribe alternate? We cannot prescribe. So the right answer is ensure proper use of medication and improve the adherence. Options देख के ही आपको eliminate कर सकते हैं if you are attentive. Otherwise चले जाता है. Right? So don't do the silly mistakes. Next question. So these are the main objectives of the patient counseling. So enhance the patient understanding, promoting the treatment adherence, communication with providers, encouraging the lifestyle, preventing diseases progression, and supporting transition care and promoting overall well-being. This is the main objectives of the patient counseling. दे सकता है pharmacist. मगर अलग बात है कोई नहीं सुनते pharmacist का. But these are the advantages. These are the things a pharmacist must do. Right. Next. Which of the following services is commonly offered in a modern community pharmacy? Minor ailment management, surgical procedures we cannot do, inpatient care दो डॉक्टर लोग देखते हैं, and chemotherapy administration. So इसमें से आप आराम से आप आइडेंटिफाई कर सकते हैं minor ailment management. कुछ वाला ही देखना है, मगर इंडिया में कुछ जगह में फार्मासिस्ट ही पूरा करते हैं, सर्जरीज भी करते हैं. It is unethical, right? Next. When counseling a patient on inhaler use, the pharmacist should emphasize. अगर patient को inhaler दे रहा है, कौन सा चीज में emphasize करना है? Holding breath for 5 to 10 seconds after inhalation, rapid inhalation through the mouth, using the inhaler while lying down, shaking the inhale only before first use. No, ये सब कुछ नहीं कर सकते. आप holding breath for 5 to 10 seconds after inhalation. Because how to use the drug you must tell as a pharmacist. No need to tell other points. Next. Health promotion community pharmacy includes all of the following except, देखो हर एक एग्जाम में you must remember क्वेश्चन के एंड में क्या है, except है या नहीं, not है, true है, right और false है. These are the words you must focus. But हर लोग क्या करते हैं, वो लास्ट वाला वर्ड कुछ भूल जाते हैं, पूरा नहीं पढ़ते क्वेश्चन को और पूरा गलत आके फिर एग्जाम से बाहर आने के बाद अरे मैं नाट को नहीं देखा और इसको नहीं देखा, एक्सपेक्ट को नहीं देखा. ये बिल्कुल नहीं करना है मिस्टेक. राइट, यहाँ पे देखो फॉलोइंग एक्सेप्ट कंडक्टिंग ब्लड ग्लूकोज स्क्रीनिंग कैंप्स, advising on smoking cessation and dispensing narcotic drugs without prescription, educating on healthy lifestyle. So the answer is dispensing narcotic drugs without prescription. ये सब हम नहीं कर सकते. Next. So which of the following is a primary responsibility of a clinical pharmacist in a hospital setting? So hospital setting में what is the main primary responsibility of a clinical pharmacist? So conducting drug utilization review and patient counseling. So बाकी सब हम नहीं कर सकते. Next. Yeah, next slide, next question. What is the main purpose of the TDM, therapeutic drug monitoring? Therapeutic drug monitoring का purpose क्या है? To check the expiration of drugs, dates, no. To ensure drugs are sorted at correct temperature. To measure drug level in blood for efficacy and safety, and to dispense medication to ICU patients. So the right answer is C. To measure drug levels in blood for efficacy and safety. That is the main use of TDM. Okay, purpose of TDM. Next, unit dose dispensing system refers to bulk dispensing of drugs towards dispensing one dose per container for individual patients, selling drugs through the retail counters, preparing large batches for 4 admixtures. So the right answer is dispensing one dose per container for individual patients. Right. Next. Which of the following drug requires routine liver LFT monitoring during therapy? This is very very important because जो drug liver metabolize कर रहा है ज़्यादा से ज़्यादा and it is affecting the liver, you have to monitor entire treatment. Okay, LFT. So what are the drugs? Metformin, atorvastatin, paracetamol. These are all drugs will cause liver toxicity. Okay, that's why you have to monitor entire treatment completely. It may be 3 months or 6 months or 1 year. Next. So these are the very important LFT monitoring. So these practitioners and pharmacists must know and must explain this information to the patient, and sometimes pharmacists must explain to the doctor also about this LFT monitoring. Next, so these are the major drugs where we must focus on LFT monitoring, especially antimicrobials. Okay, tuberculosis drugs, क्योंकि TB treatment में long term treatment they will do. Okay, patient undergo long duration, so that's why they must monitor what is happening to the liver function test, whether it is damaged completely or what. You have to change the dose. If it is completely damaging the kidney, so liver, then you have to change the dose. So that's why monitoring is very important. Antibiotics and some of the CNS drugs, anticonvulsants, antidepressant, antipsychotics, and statins, right? And especially methotrexate. We were discussing so much about methotrexate. So very important. It will, the side effect of methotrexate is phocomelia, right? So these are all very important drugs, and they have serious side effects. You must note it down. Next question. Which part of the plant is used? Coming to the pharmacognosy, very important. Cognosy में कुछ भी नहीं है. You must know the biological source and family chemical functions. That's it. Okay, you will get the questions. You will get the marks. So digitalis purpurea का source क्या है? Right? So you must remember the biological source properly. Not only the plant name, whether it is root or stem or bark or what. That is important. So here, if you talk about digitalis, always that is leaf. Okay. So digitalis purpurea. What is the family? So Scrophulariaceae. Just अगर drug का नाम आए तो आपको family name आना है. This is very important for all the entrance examination. So this is the picture of digitalis. Digitalis leaf. देखो बहुत सुंदर है पिंक कलर में, राइट? डिजिटालिस लीफ, मगर उसको अच्छा तरह से यूज करना है. अगर ज्यादा यूज कर डिजिटालिस टॉक्सिसिटी आ जाता है, राइट? सो दिखने में सुंदर है मगर बहुत डेंजर है, इसलिए you have to monitor the dose properly. That is digital. What is the synonym of the digitalis? This is a repeated question. Foxglove. So many examination. Digitalis foxglove. Okay. So what is the main chemical constants? So उसमें you know very important chemical constants है. So digitoxin and main percentage of the percent of glycosa also very important. Digitalis contain 0.2 to 0.4% digitalis, right, of glycosides, and important digoxin, gitoloxin, and verodoxin, right, and digitonin. Saponins का digitonin and gitonin, and it also contains 2 to 6% of volatile, and it also contains cineol, right, and tannins and pectin. These are the chemical constants, very important, we use in the cardiovascular diseases. Next, which of the following is a plant derived alkaloid used in the treatment of acute gout? Gout नाम आए तो आपको colchicine, right? Colchicine, okay? So acute gout, okay? Gout is it's kind of joint pains, right? So colchicine, and the main brand name for this is Xyloric. Okay, next, medicine in the medical shop में हमेशा Xyloric brand commonly used. So colchicine and gout. Next, coming to another question. Withania somnifera, ashwagandha. Ashwagandha के हर part we can use it. So there is a company now in Hyderabad. They use all parts of ashwagandha and they'll make the money from the every part of the plant. That is adaptogen. Okay, ashwagandha. So we use multiple uses. We can go through the uses of the what are the main uses. So root also we use, branches and leaves, flowers, fruit and seed. Every part is useful. That is ashwagandha, Withania somnifera. Right. Next question. The latex of Papaverum somniferum. The source of, okay, Papaverum somniferum, Papaveraceae family. So the important, very important, that is codeine. Okay, narcotic. Next. Which of the which inventory management techniques classifies items into ABC analysis? So इस questions को बहुत सारे लोग ignore करते हैं, मगर no need to worry. So you just concentrate on the inventory method. ABC analysis में बहुत सारा questions है इसमें से, right? And there are some other terminology I'll tell you. So just if you remember this terminology, you will get the marks. Coming to the ABC analysis. क्लास ए में क्या है, इसमें कॉस्टली आइटम्स होता है. इफ यू आर गोइंग टू स्टार्ट ए मेडिकल शॉप, यू मस्ट फोकस ओनली 20% ऑन द कॉस्टली आइटम्स. दैट इज क्लास ए. एंड देन क्लास बी ओनली 30%, राइट? सो दीज आर द लेस इंपॉर्टेंट आइटम्स, ज्यादा यूज नहीं होता. देन कमिंग टू क्लास सी, इसमें यू हैव टू इन्वेस्ट मच बिकॉज मोस्टली यूज्ड ड्रग्स and the less valuable items. So in this way you have to follow the ABC analysis model. Next question. What does the term a important terminology है, right? So in especially drugstore and business man, FIFO, right? FIFO, right? And then another terminology. So I'll tell you all this. So the FIFO means first in, first out, right? So these are the main important terminology. FEFO, first expired, first out, and second FIFO, right? First in and first out. LIFO, last in and first out. Based upon the usage, based upon the importance, based upon the prescription, these should be followed. Next. So these are the some important features of all three different terminology: FIFO, FIFO, and LIFO. Right? So you just go through the slides. Very very important. And which are which category drugs are first given from the pharmacist, okay, first taken from the pharmacist, and first requirement taken from the vendor. So all these details are there. Please go through the slide. Very very important. Right? Next. Which of the following is a key component in financial management in a community pharmacist? Right? So very very important. Already we know from the question, maintaining cash flow and profit margins. Next. What are the value added services? So बहुत सारा हम मार्केटिंग में जाके देखते हैं, मगर हम सब्जेक्ट में भी है वैल्यू एडेड सर्विसेज क्या है फार्मेसी में, राइट? सेलिंग जेनेरिक ड्रग्स एट लोअर प्राइसेस, ऑफरिंग फ्री ब्लड प्रेशर स्क्रीनिंग एंड हेल्थ कैंप्स, डिस्प्लेइंग प्रमोशनल बैनर्स, स्टॉक फास्ट मूवमेंट ब्रांड्स. नो, इसमें हम वैल्यू एडेड सर्विस क्या क्या है? ऑफरिंग फ्री ब्लड प्रेशर स्क्रीनिंग एंड हेल्थ कैंप्स, ये हम दे सकते हैं हमारे मेडिकल शॉप के सामने, right? Value added services. So these are the different value added services: patient education, medication therapy management, MTM, and immunizations, and health screening and financial assistance program. So if you conduct these kind of programs, this will become as a value added service to the customer and flow, and your counter will also increase. Next. Which of the following liver enzymes is most specific for the hepatocellular damage? Very very important in the biochemistry point of view. Alkaline phosphatase, aspartate aminotransferase, alanine aminotransferase, gamma glutyl transferase. Very very important. The right answer is alanine aminotransferase, ALT. अगर आप LFT देख रहा है, राइट, आप बायोकेमिकल प्रोफाइल्स चेक कर रहा है, राइट, सो दिस एंजाइम लेवल शुड बी मॉनिटर्ड प्रॉपर्ली. What is the physiological conditions, right? If you go through different blood CBPR, complete health check profiles, so these common tests are suggested by the doctor. Next, a patient on lithium therapy should be monitored for changes in which electrolyte? Lithium therapy, right? The right answer is sodium, because sodium ions or sodium channels will be blocked, okay, in lithium. Next. So the other drugs in lithium therapy: bipolar disorder, other conditions, and neuroprotective effects, and unipolar depression, suicide and aggressivity, and other mental health conditions. So in these conditions we use lithium. Next. Which of the following is a normal fasting blood glucose? Very simple question and confusing sometimes. So you must remember what are the levels: 70 to 90, right? So this is the, and important, you remember the units. What are the units for the blood glucose levels, right? So mg per deciliter, and these are the different ranges of blood glucose. 70 to 90 is normal, and pre-diabetic 100 to 125. Remember, this is very very important, and diabetes means above 126, right? So these are the different ranges of blood glucose levels. Next, coming to the presence of protein in urine. Repeated question in Telangana Pharmacist exam, Drug Inspector exam, AIIMS, RRB, and all the competitive exams. Hematuria or proteinuria. It's the two terminology very very important, right? So associated with liver cirrhosis, kidney dysfunction, UTI, and dehydration. Important is kidney dysfunction, right? Next. So these are the main proteinuria conditions. If it is 30 to 100, right? 30 to 100 mg per deciliter, important. Okay. If it is crosses 100, that is abnormal. You remember the average limits of proteins, right? Next. So especially we will measure albumin in that. Next, hematuria. So hematuria, again we will see the blood in the urine, right? So greater than 3 to 5 RBCs in a per HPF, then it will cause hematuria, right? It is considered as a hematuria. Next question. Which of the following 5 year, coming to the general questions? So these are very general. I have given these questions in an overview. As a pharmacist, we will not go into deep, but sometimes we need to score, right? So follow these questions, repeated questions they are asking from these slides, right? So which one is a 5-year plan? Right? That is Harvard-Domore model, right? So first 5-year plan is based upon Harvard-Domore model. And what is the current 5-year plan? There is no current 5-year plan, because that is 5-year plan replaced by Niti Aayog, So now the 5-year planning commission entirely taken care by Niti Aayog. So if you calculate the which 5-year plan, it is 16th 5-year plan we are running now. That is 2025 to 2028. But it is comes under Niti Aayog, right? So next. As of 2024, which country assumed G20 presidency after India? India के बाद कौन सा country G20 को presidency लेगा? That is Brazil, right? So then after South Africa, then US. Okay, so currently South Africa is the presidency. Then after South Africa के बाद 2026 में US लेगा. So G20 summit है, G20 countries होता है. Then we are also part of that. So we have monitored presidency in 2023. हमारे बाद ब्राजील लिया. Then उसके बाद South Africa अभी चल रहा है. Then उसके बाद US उसका presidency लेगा. Next, who among the following founded All India Harijan Sangh? Okay, so उसका आंसर है Mahatma Gandhi. So he is the main preceded person to conduct Harijan, All India Harijan Sangh in Maharashtra in 1932. Right. Next, who became the first Indian woman to win gold medal? So कौन सा जो वुमेन है फर्स्ट गोल्ड मेडल जीता है? So ये जो भी वुमेन लोग है यहाँ पे हिमा दास, अंजू बॉबी जॉर्ज, मनु भाकर, all are first women to win the medals. But here you must focus which medal. So here they asked gold medal. So Anju Bobby George won the bronze medal first time in 2003. Okay, all are won first time, but which medal? So nobody won gold medal at that time. So here we see Hima Das. Hima Das is the athletics. Anju Bobby George in long jump. Manu Bhaker is shooting. So first remember the category, and then Anju Bobby George is the first woman to win the bronze medal. But in the question they asked a gold medal, right? So concentrate on the question, right? And then 2022 mein first Indian woman to win the gold in shooting in Commonwealth Games. So remember these three ladies, very important ladies, to get the marks. Next, World Environment Day is celebrated on. So it is my birthday, 5th June. Please remember on that day, World Environment Day. So we will celebrate. Next, the Battle of Plassey was fought in which year? जो बैटल ऑफ प्लासी है, वर्ल्ड वार्स है, राइट? इसमें से हमेशा क्वेश्चंस आता है. वर्ल्ड वार 1 कब हुआ, 2 कब हुआ, 3 होने वाला है, अभी नहीं हुआ. बस 1, 2 याद रखो और बैटल ऑफ प्लासी याद रखो, हिटलर को याद रखो, राइट? दीज आर द मेन इंपॉर्टेंट की इवेंट्स इन द हिस्ट्री. जस्ट रिमेंबर दैट, डोंट गो इनटू डीप, राइट? सो बैटल ऑफ प्लासी occurred in 1757. नेक्स्ट कब हुआ? 23 जून 1757. किसके साथ हुआ? ये सिराजुद्दीन दौला के साथ हुआ. किसको? ब्रिटिश वाला, राइट? सो जस्ट रिमेंबर किसको किसको हुआ, राइट? नेक्स्ट, हु इज द ऑथर ऑफ द बुक विंग्स ऑफ फायर? सबसे फेमस बुक है इन द वर्ल्ड एंड फेमस पर्सनालिटी फ्रॉम इंडिया इज अ ग्रेट साइंटिस्ट, दैट इज एपीजे अब्दुल कलाम. विंग्स ऑफ फायर, ये बहुत सारा बुक्स लिखा है उसने. फोर्ज ऑफ इंडिया 2020, विजन 2020, ऐसा बुक्स लिखा है उसने. बट विंग्स ऑफ फायर इज वेरी फेमस, दैट इज अब्दुल कलाम. नेक्स्ट, so who received Nobel Prize in 2014 for the struggle against child labor? So 2014 में Nobel Prize किसको मिला? 2014 को इसलिए फोकस किया, that is the last Nobel Peace Prize got India. उसके बाद नहीं आया किसी को इंडिया से, राइट? सो वो भी पाकिस्तान से शेयर किया हमने. सो पाकिस्तान का लड़की है जो मलाला, and she and from India Kaila Satyarthi, they got Nobel Prize for the first time in the peace, right? For the child labor. This you remember, very important. उसके बाद हमको पीस प्राइज फिजिक्स में मिला, अदर मिला, बट पीस में नहीं मिला. नेक्स्ट, व्हाट इज द कैपिटल ऑफ यूनियन टेरिटरी ऑफ लद्दाख? सो बहुत सारे लोगों को मध्य प्रदेश का पता है, तेलंगाना का पता है, यूपी का पता है, मगर याद रखो यूनियन टेरिटरीज का, अंडमान निकोबार का क्या है, लक्षद्वीप का क्या है, जो भी छोटा छोटा चीज है उसको याद रखना, उसमें से क्वेश्चन आ सकता है. उसका है ले, राइट? लद्दाख ले. नेक्स्ट, दिस इज कंसिडर्ड एज ए यूनियन टेरिटरी रिसेंटली. एंड अनदर इंपॉर्टेंट क्वेश्चन, जीएसटी. बहुत सारे लोग कंफ्यूज हो जाता है, जीएसटी का फुल फॉर्म क्या है? एज ए फार्मा बैकग्राउंड वी मे कंफ्यूज, बट डोंट कंफ्यूज, वेरी इंपॉर्टेंट. गुड्स एंड सर्विस टैक्स, डोंट गेट. नेक्स्ट क्वेश्चन, सो जीएसटी कब चालू किया? 1 जुलाई 2017 ने नरेंद्र मोदी इसको शुरुआत किया. जीएसटी 2017 में किया. देयर आर 2 टाइप्स ऑफ जीएसटी है. आईजीएसटी है, इंटर का स्टेट का है. सीजीएसटी है, सेंट्रल का है. आईजीएसटी मींस that is state, right? Interstate GST. There are only 2 GSTs. Next, what is Niti Aayog? A full form. बहुत सारा exam में ask what is a full form. So many people do the mistake on this question. National Institute for Transforming India. National institution. और बाकी नीचे लोग सब लोग एलिमिनेट करते हैं, मगर आता है प्रॉब्लम ARB. Don't get confused. It is National Institution for Transforming India. ऐसा याद रखो, to inspire India, inspire करने के लिए ये इंस्टीट्यूशन बनाया, that is नीति आयोग। और करंट उसका चेयरमैन है, वो कौन है? हमारा चेयरमैन, उसका चेयरपर्सन प्राइम मिनिस्टर ऑफ इंडिया, एंड उसका CEO है, so उसका नाम okay, yes, next it will come. Next question. Next, Make in India started in which year? आजकल बहुत सारा चल रहा है इसके लिए, because we are doing so many innovations, so many discoveries from India, and this is coming from Make in China. So Make in China से कॉपी करके हम Make in India बनाया, and we are doing so much to avoid the import, especially bulk drugs from the China, and we are doing so much in pharmaceutical sector, and that is started in 2014, Make in India. So this is started by Narendra Modi, 25th September 2014, and is mainly focused on global manufacturing hub, to make India as a global manufacturing. And there are some other important terminology: Digital India, Startup India. These are the part of the Make in India program. But Startup India, they removed that, and now they are launching new schemes. Next, which of the following pairs incorrectly matched? So capitals. These are the common questions asked in every competitive exam. Canada, Ottawa; Australia, Sydney; Japan, Tokyo; German, Berlin. The answer is Australia, Canberra. Australia का कैपिटल है कैनबेरा, मगर बहुत सारे लोग सिडनी को याद रखते हैं बिकॉज इट्स अ मेजर सिटी इन ऑस्ट्रेलिया। सिडनी को पहले था, उसको रिमूव किया, एंड मेलबोर्न सिडनी का बीच में झगड़ा हुआ, उन दोनों को हटा के they made Canberra new city that became a capital city of Australia. Next, where is the headquarters of International Court of Justice, ICJ? कहाँ पे है? So Geneva, The Hague, New York and Paris. The Hague में है, वो नेदरलैंड में है, that is International Court of Justice, right? And this is also known as World Court, जो दुनिया का कोर्ट बोलते हैं, और that is World Court, वो नेदरलैंड में है, हेग में है, and this is appointed by the UN, and that is in the New York. UN headquarters उसका न्यूयॉर्क में है, right? Next, which Indian space mission successfully landed near the moon's south pole in 2003, and this is the major discovery from India in as an astronaut and aerospace, right? So चंद्रयान सब लोग जानते हैं, मगर इसका चंद्रयान 1 है, चंद्रयान 2 है, चंद्रयान 3 है, चंद्रयान 4 जाने वाला है और नहीं है अभी तक, मगर जस्ट यू फोकस ऑन 1, 2, 3. 1 कब हुआ, 2 कब हुआ, 3 कब हुआ? 3 सक्सेसफुल हुआ। सो उसमें चंद्रयान में दो चीज इंपॉर्टेंट है, कौन सा लैंडर है, कौन सा रोवर है। लैंडर का नाम है विक्रम है, रोवर का नाम प्रज्ञान। ओके, रिमेंबर दिस टू नेम्स, राइट? सो 2023 में सक्सेसफुल हुआ है। फर्स्ट चंद्रयान 1 इज 2008 में स्टार्ट किया, दैट इज फेल्ड, एंड चंद्रयान 2 2019 में किया, वो पार्शियली सक्सेसफुल है, वो भी क्रैश हुआ, उसका लैंडर क्रैश हुआ, मगर प्रज्ञान इज रोवर इज वर्किंग स्टिल, इट इज गिविंग द इंफॉर्मेशन, बट चंद्रयान 3 is successfully landed, and our country is the first country to land in south pole of the moon, that is Chandrayaan 3, and this is a successful discovery from the Indian science. Next, who is credited with the discovery of structure of DNA? Crystal structure of DNA को किसने बनाया? जेम्स वाटसन क्रिक मॉडल हम बोलते हैं ना, जो वो लोग क्रिस्टल स्ट्रक्चर को बनाया, मगर इससे पहले जो उसका बाद में और दो लोग हैं इनोवेशन में, वो एक लेडी, शी इज नॉट गेट द नोबेल प्राइज, बट वाटसन एंड क्रिक, एंड सम अदर नेम, the other name is also, the 3 members got the Nobel Prize in 1965. Okay, so उसके 1965 में नोबेल प्राइज मिला है, and 1953 में they discovered the crystal structure of DNA, right? Next, which 5-year plan was terminated 1 year before its completion? So बहुत सारा 5 years plans हमने देखा है पिछले स्लाइड में, all 5 years plans देखा है, और जो भी 5th 5-year plan था वो 1 साल के पहले ही टर्मिनेट हुआ है। So that is 5th 5-year plan 1974 to 1978. Actually, it should run up to 1979, but it is terminated before 1 year. That is 1978 में terminate हुआ. That is 5th 5-year plan. So if your 5-year plan is very very important, right? Next, Vande Bharat Express. This is very very common and very popular question expecting in every examination. Vande Bharat Express क्या है, right? So involved in aviation, roadways, railways and shipping. So remember, this is only related to railways, no relation to the roadways. What is the first Vande Bharat Express? Where it is started? So from between Delhi to Varanasi in 2019. Okay, remember this. ओके उसके बाद बहुत सारा वंदे भारत एक्सप्रेस स्टार्ट हुआ मगर वो फर्स्ट वाला क्या है वो याद रखना है दैट इज वेरी वेरी इंपॉर्टेंट नेक्स्ट who is the minister of chemicals and fertilizer because we are belong to pharma we must know the health minister and chemicals and fertilizer अच्छी बात ये है कि दोनों का सेम ही मिनिस्टर है दैट इज जेपी नड्डा राइट सो रिमेंबर वो दोनों का मिनिस्टर हेल्थ मिनिस्टर भी वही है उससे पहले दूसरा था मगर अभी जेपी नड्डा ने दो चीजों के ले लिया मिनिस्टर ऑफ केमिकल्स एंड फर्टिलाइजर्स एंड आल्सो हेल्थ मिनिस्टर इज द पर्सन राइट नेक्स्ट which of the following is the highest civilian award in India so highest civilian award क्या है इंडिया में everybody knows it that is भारत रत्न who received first भारत रत्न अभी रिसेंटली कौन रिसीव किया है अभी 2024 देख लिया है तो सो 2024 में ये पूरा लोग रिसीव किया है 5 लोगों को मिला है भारत रत्न 2025 में अभी तक नहीं दिया देने वाला था मगर अभी तक नहीं कंफर्म हुआ चल रहा है उसका डिस्कशन मगर 24 में रिसेंट सिलेक्शंस फॉर भारत रत्न Kapuri Thakur, former Bihar Chief Minister, Lal Krishna Advani, LK Advani is very famous person in BJP, and P.V. Narasimha Rao, South Indian person who became a Prime Minister and Chief Minister, and another Chaudhary Charan Singh, former Prime Minister of India and CM of Uttar Pradesh, and M.S. Swaminathan, very well known about Green Revolution. ये 5 लोगों को ये मिला है Bharat Ratna. Okay, so this is what the common general questions and also paper discussion of AIIMS mock test 1. I hope this will be helpful for your preparation and this last minute preparation. Just follow our channel and from our channel you will get many direct questions. Just go through the video and just try to note it down the important points. Okay, because we are training students from last 15 years and so many students became government officers by following our channel and following our guidance and I hope you will also become successful and my best wishes always with you and please follow our channel Instagram channel and YouTube channel and for further videos also we are going to make on mock tests and topic wise videos also please follow our YouTube channel and share with your friend so that will become a turning point to your friend right so thank you for watching us and please do follow and share subscribe and like